There you go.
Man, thank you very much. Well, I apologize for being a few minutes late. We were waiting for a quorum. Everyone is here, so we can start the meeting of the Maine Recovery Council. I first want to welcome any public that is joining us via the Zoom, and also we have members of the public in our audience and want to welcome them to our meeting. And I want to say, before we do introductions, from what I see, Maine had a very successful recovery month in September, and there was celebrations of recovery from one end of the state to the other. That was really great to see. And then it's not quite recovery month, but last week, Gordon and I had the opportunity to attend the opening of the Piscataquis County Recovery Center, and I can tell you, as much as work, this was such a joy to be there. Many people of the public were there. There was recovery stories were there, and it was absolutely, I was so proud to be a member of the council that made the funding possible for the center to open, and encourage any of you, if you're traveling up to Moosehead Lake up there, swing by and see that recovery center. It is a positive place to be, and they're so grateful for that opportunity, and I have full faith that with the 2 years of our support, they will be fine at the end of those 2 years and be running strong. So I just want to tell everybody, congratulations, money well spent and invested, I should say. So, all right, thank you all. So I'm going to ask for those members a quick introduction, and I'll start right here.
Great. Representative Lydia Kraft from Newcastle. I'm also a clinical social worker.
Hi, I'm Pat Kimball. I'm a recovery ally, a family member, and chair of the council.
Hi, I'm Mary Coyne. I'm the coordinator for the recovery council.
I am Grayson Havens. I'm with the AG's office.
I'm Katrina Bonish. I'm with the AG's office.
Chastity Toole, harm reduction consultant and advocate. I'm Liz Bucklemore, she, her, and I am the director of public health for Cumberland County Public Health.
Gordon Smith, he, him, and I'm the state's director of opioid response at Governor Mills' office. Paul Vinsel, addiction medicine physician with Spurwink and the family medicine residency at Central Maine Medical Center.
Thank you, and I'll ask those on Zoom. Brendan, you want to start?
Hi, I'm Brendan O'Neill with the Attorney General's office.
Bruce?
Good afternoon, Bruce Naughton, Maine Reentry Network, person in long-term recovery and a person who lives with mental health challenges. Good to see everybody.
Thank you. Ben?
Good afternoon, everyone. Benjamin Mann, Deputy Commissioner of Finance at the Department of Health and Human Services here in Maine. I'll go over to Sheriff Brackett.
Good afternoon, everyone. My name is Todd Brackett. I'm the sheriff in Lincoln County.
Eric, please.
Good afternoon. My name is Eric Small. I'm the police chief here at the Sanford Police Department. I represent the litigating subdivisions. Thank you.
Thank you. Kina?
Hi, everyone. Kina Thakrar, infectious disease and addiction medicine doc in Portland.
Courtney?
Hi, everybody. My name is Courtney Gary Allen, Executive Director of MeRAP and a person directly impacted by drug use.
Thank you very much. I think we get everybody. All right, thank you. So a quick overview of the agenda and how it will play out. I am going to have a quick discussion about term and how that's going to work, the re-upping of terms. And then we will review the minutes of September. Then we'll have contracts with Brendan. Then we will discuss the executive session that the executive committee had a couple weeks ago. Then we'll do the coordinators report, which I'll also include in that grants and program, then finance report, and then we will have a presentation by the prevention work group to share with us their thoughts and strategies in regards to prevention. So that's, as usual, a full meeting. So I will try to keep us all going and moving forward, but at the same time, allow for people to ask questions and share thoughts. So again, first, quick discussion on term limits. As you all know, your terms expire November 21st. And so if you would like to serve as a second appointment, please contact that person who nominated you and share with them that information, please. And if you do not, wish to continue, can you please notify them also and also notify me so that I can keep track of how many appointments we have? I have reached out to the Attorney General's office, Speaker of the House, President of the Senate, and someone in regards to the litigating partners, to add an extra sort of poke to them to be able to, for them to understand we are really trying to do this with very little interruption. So we're trying to smooth that through. We'll talk a little bit about the transition in another segment of this meeting. But do you have any questions in regards to that?
Brendan, do you know who the contact is now at the subdivisions? Because the subdivisions nominated, there was like a nomination process and 4 folks came out of that, and we aren't sure, you said who to contact, and we aren't sure who to contact now. Do you know?
Yeah, thanks. Thanks, Liz. I put Pat in touch with the attorney attorney here in Maine, who represents the litigating subdivisions. That person is Representative Adam Lee from Auburn. You may remember he attended the Recovery Council's presentation at the Governor's Summit and, asked a couple of good questions. So I put Pat in touch with him, and I asked Pat to take the ball from there. I don't, that was probably just earlier this week, but Pat may have more information on that.
I have emailed him and he has not responded to my email.
Okay, well, and I'll go through the
Yeah.
channels within county to see who.
And if
we
you
can
find
somebody.
that lead, if you let us know,
I'll
so
let you
we can do that.
For other folks.
And Liz, I don't have any transparency on the subdivisions process, so that's the only thing I can do that I'm aware of.
Okay, great.
We'll figure it out.
We'll figure it out. I was like, who am I contacting?
Yeah. Well, I said something, I was wondering if you have, I know the Attorney General's office sent a letter. So I was wondering if people who were appointed were sent a letter and who signed that letter. That may help. So if you received a letter and you still have that, see who signed it.
Okay.
It may be him.
Thank you.
All right, thank you. Betsy is not here, I'm seeing, so I need somebody to take minutes.
I'll work on it.
All right, we've got a minute taker, we're great. So with that said, you have the minutes of the September meeting. If I hear a motion to accept that, or we accept the minutes to the meeting, the September meeting, the Recovery Council. It's been moved, it's been seconded. Is there any discussion in regards to the minutes that have been sent? If not, Grayson, could you call the roll, please?
Of course, Liz Blackmore,
Yes.
Todd Brackett. Todd Brackett,
I'm sorry, I'll abstain. I wasn't at the meeting.
Lydia Crafts,
Yes.
Courtney Gary Allen,
Abstain. I can't turn my camera on.
Pat Kimball,
Yes.
Tim Mann,
Yes.
Bruce Naughton,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Tina Thackrar,
Yes.
Chastity Toole,
Yes.
Paul Bitzel.
Yes.
That passes.
I think the motion carried. Thank you very much. All right, so I'm going to turn the meeting over at this point to Brendan to discuss contracts, our favorite subject.
Thanks, Pat. And Pat asked me to be brief about this as much as possible, so I'll try to race through this. And I'm going to start with the syringe service providers contract. Mary provided to you the latest red line of the part of the contract that deals with the deliverables. The summary is Mary helped organize a meeting of the 10 or so providers to go over the draft of the contract, and that was earlier this week, I think. We received some feedback, or that was last week, I guess. We received some feedback from that meeting, and Chastity attended that meeting also. And between the feedback directly from the providers and some feedback from Chastity. We went through the deliverables and marked them up to accomplish a couple of things. And I'll try to again be brief about this. One request was to be more clear about the fact that these funds were meant to be flexible funds, so that, in other words, as background, I started with what I understood to be the CDC's version of the uses of the funds under their contracts, and I was asked to make it more clear that these funds are meant to be more flexible, so that providers who are of different, do different things, can provide some but not all of the services depending on what's appropriate for them. So I've amended the language to try to make that more clear, both at the beginning and there was already a catch-all at the end, but hopefully those will work together. I was asked to make it more explicit that entities could use the money to pay for vehicles to provide mobile services, that they could use the money to purchase a facility, a building, to provide their services. We got a couple of questions about whether providers could use the funds to repay debts, either related to purchasing the building or purchasing supplies. From my perspective, so long as the money is used for syringe service program, purposes, there's nothing in the MOU or the approved uses or the settlements that would prohibit that. The council may want to weigh in on that, but I just flag it as something that was asked. Courtney worked with me. I'm sorry, Chastity worked with me to make the language more broad to make it clearer that the state and federal restrictions on the use of the funds for, say, for example, smoking supplies, were permitted. And there's sort of general language about that at the end in the sort of other category, which is paragraph E. And we've been asked to make it yet more explicit, so we may add more language about that. In my conversations with Chastity, we've done some work to what I understand to be sort of minimizing or minimizing is probably the wrong word, but reducing the language in the deliverables to effectively broaden the uses for the different kinds of SSPs and the different kinds of work they do. And that may be too brief of a description, but I want to, at this point, you should all know that I had previously circulated this to the Finance Committee, received a couple of comments from them, had a discussion there. So I want to, provide any member of the Finance Committee, or Chastity, who may want to, jump in and talk about anything that I, talked about or didn't.
We're all set. Brennan, you keep going. I don't see any hands.
Pat, I've noticed that Betsy's joined us. Do you want to ask her to introduce herself?
Hey, Betsy, would you like to introduce yourself to us, to the members of the public?
Yes, and apologize for being late yet again. Betsy Fitzgerald, representing the counties.
Thank you, Betsy.
So we wanted to share the current status of things. We hope to, in the coming days, try to get something down to a final version that can be recirculated to the providers so that they can do their due diligence and review it. If I would certainly, invite any council members who had any feedback on this new iteration to, send me your feedback. I would suggest by Friday, not tomorrow, next Friday, um, so that we can, as quickly as possible, turn around a final version for the providers so that they can. We've heard from some of them, some of the bigger entities, that they require 30 days of their own review time because they're in institutions, and so we want to be respectful of that and try to get the money out the door. We were trying to get them a version of this that they can work with. Happy to answer questions about the red line. Another thing that was raised that frankly needs more work are the reporting requirements, both the financial and the performance reporting. I had intentionally drafted it to try to piggyback on the reporting that they're already doing to the CDC, with the idea that would be easier for them than doing somebody else's totally different reporting. However, we heard back from them that had the opposite effect, for a variety of reasons related to software, which I invite others again to describe that better than I can. But we need to do a little bit more work on exactly what the reporting will be, and there's one other issue that I think is probably a good idea to talk about, which is there were sort of two issues related to the funding, but I want to pause there and see if there are any questions at this point.
Courtney, you have a question?
Yeah, just super quick, Brendan. I'm good with everything that you've done. This looks great. If Chastity's good with it, I'm good with it pretty much. And my question to you was, do you need a vote by the full council to actually get this signed, and I guess the question is, do we do that now, or can we wait till the next full council?
I don't believe I need a vote about getting the red line out, about getting the final contract out. There are two issues that I'll turn to now that I think I do need sort of clarity on, and a vote on one of them. One of the questions we got from the providers is related to language in the contract that says, any funding that isn't used by the end of the term of the contract needs to be returned. I think the questions were generally about, does the count? I think it was sort of two questions, and and Mary, you should, or anybody else, feel free to jump in. One of them was, just to confirm, the council intends the providers to use all the funds within the term of the contract, not carry any over beyond that, or expend it further if they haven't expended it all by the end of the contract. A related question that we've got some feedback from Ben about, I think, was about sort of referring to the concept of whether that funding could be considered deferred income or something like that. I don't have enough expertise in those kinds of matters to really understand the question, but I think one of the questions, I do want to confirm that the council intends folks to spend the money within the term of the contract.
I can give you my thought. I don't see anybody else's hand, but my thought is that they spend the money within the terms of the contract. Unless there's some reason we delay the contract and they only have a half a year, I certainly don't want to happen that they spend money frantically on things they don't really need, because they've got a short time to spend it. But if we have a yearly contract and the idea is for them to spend the money, not to put it in a fund for later, I say that they spend the funds or they return them. But that's just me. And then Representative Cohen.
I'm just wondering if the expectation would be that they spend them, and if they couldn't spend them, that they would come back to the council and we would permit the carryover, something that gives us flexibility but says the expectation is to spend it.
Yeah.
That would be my request, is that we perhaps put in a clause of the expectation, if you spend it, if you want a 6-month extension or some sort of extension, please come back with.
They have to submit one.
Yeah, submit some sort of like very brief thing.
Yeah.
I think this will come up in prevention work groups, recommendations. But spending timelines are really tricky.
Yeah.
And, you know, there's contract stuff on one end, there's you have somebody leave a position and you refill the position and it's not the same as we thought it was gonna be. And I mean, I just think if the more we can be real with folks and giving people real time, like, we don't want the money back.
No.
We want
But
them
we-
to do the work in communities. So I think it's like, how do we balance those things of expectations plus giving people an option to say, we'd like an extension, here's how we're gonna spend it. And it's gonna be smart spending. Like you said, we don't want them to spend out.
Cause we gotta spend this money and so
And so
here we
now
go.
we're gonna do something
Again,
silly.
I
Like,
lived
which they
through those
would
days
do,
in the
but
old
like,
days.
yeah, it's a balance.
Yeah, I like that idea. Todd and then Ben. Thank you.
Yeah, I think, can you hear me okay?
Yeah.
I think my question is really kind of along where Liz was going. I mean, if the spend mean encumbered, you know, if we've ordered supplies and it's 2 months before the end of our contract and the supplies haven't come, so we haven't received an invoice, but they've been ordered, or we're hiring a position, but the person hasn't started yet. Or you know what I mean, whether those funds have been encumbered but not actually spent, does that mean the same thing?
That's a Ben question.
It doesn't mean the same thing, but I think as long as they have it, they would need to, they would need to, well, they need to spend the dollars within the contract period. I don't think, I mean, they would only be, is your question, Todd, if they subcontract out again? Because the contract's between the Maine Recovery Council and them. So they're not going to re-encumber the funds. They're just paying personnel or paying for supplies or whatever they're doing with the funds. And they would need to do that by the end of the contract date.
I wasn't thinking that complicated, Ben. I was thinking of things like, I think of my own budget when we're on a calendar year, we've got to expend funds. You know, I've made purchase requests, orders, things that are supplied. Sometimes I have suppliers actually try to get me an invoice before the end of the year, even though we haven't received the product, to try to, I'm just talking about those kind of situations where you know, where there might be something that legitimate that's holding up the actual expenditure, but it's been, you know, those funds have been tied up, encumbered, whatever the right word is, before the end of the year.
Yeah, I hear what you're saying. That scenario is more, your scenario there would be more the equivalent of the Maine Recovery Council side of things, as opposed to the syringe service provider side of things, I think. And just quickly, I generally agree with folks. I do think like we should expect the funding to be spent within the first year of when we put the contract in place. I would anticipate the contract start date will be sometime in the future, so they won't have a partial year. Like when we're ready to encumber the contract, it'll be from November 1st until October 31st, 2025, and they'll have that year to spend the 75,000. If they didn't spend the funding, they could ask for an extension, but if they didn't ask for an extension, I would think that we would expect the funding to be returned so we could spend it elsewhere on higher priorities if they're not spending the dollars.
Thank you, Ben. Courtney?
Yeah, I agree with the sentiment that everyone has just said. There's lots of needs right now. So if folks aren't spending the money, then it needs to go somewhere else. But with the flexibility of, if they ask for an extension, I imagine a future council would be open to that under particular circumstances as they might be. I'm a little like, the only time that I would put money in the next year or something like that, which I think is what the ask is if I had too much money, which I've never experienced, but that would be why I would do it if I was overfunded. And so I'm just like little cautious about, do they not need the money or something that they're thinking about budgeting 3 years in advance? I don't know, but the spend the money is my essence.
So So Brendan, do you need a vote on this?
I don't. There's already language in the contract that says, any funds not spent by the end of the term needs to be returned. And so I think I have enough clarity to, for, any future conversations with the providers. At least I think I do. Mary and Chastity have both participated in those meetings. So if either of you think we need more, feel free to jump in.
So you'll make the changes that it seems to be the consensus of the council that
Yeah.
if they have a reason to keep the money, that they can submit something to us so we can vote that in.
Yeah.
Okay. So if there's no other discussions on that, do you want to talk about the allocation for sanctuary?
Pat, are you asking about the change in the funding amount?
Mm-hmm.
Let me preface this by saying this sort of treads on the finance committee's recommendations. So if Ben, if you'd prefer to handle this as the chair of the finance committee, that's fine. Otherwise, I'll just introduce the concept. The idea, so at the finance committee, the discussion was, and I think maybe Katrina or Grayson, if you could put up on the screen the two versions of Table 1, or at least the first version of Table 1, which you all should have as part of your handouts today. So this version of Table 1, this is essentially, going to be an exhibit in the contract to show who's getting what and how much, and sort of the year 1 and year 2 payments. In going over this with the finance committee, there was a desire expressed to even out the payments. That this chart, so to review the bidding, we talked about there being 17 sites with a startup funding for an 18th site. At the last council meeting, we learned that there's, in fact, a 19th site, and there may be additional ones as well. This chart reflects sort of the reality of the funding for 19 sites, with the idea that the council had previously decided that Needle Point Sanctuary was going to be the provider that qualified for the startup funding as it was conceived. And then there was a question about the sort of year 2 75,000. Would that also go to Needle Point? And if so, what about its 19th site, and so forth? You can see that if you look over in the far right column under totals, you can see that Needle Point would be, with its 2 sites together, would be treated a little differently than everybody else who has multiple sites, so that they would receive $25,000 less for in total, and not receive the 75,000 per site that everybody else was receiving. So the finance committee, as I understand it, came to a recommendation for this meeting that the funding be smoothed out by increasing the total funding at the bottom right by $25,000. And can we switch to the next version of Table 1? So this version, as of 9:30, shows the difference. So this reflects the proposal, the recommendation from the finance committee to move away from startup funding concept and just say we now have 19 sites, and each site shall be allocated $75,000. And this, I think, the council does need to vote on. And so I open it up for discussion by anybody.
Is there any discussion on this? Or do I hear a motion that we accept one of those 2 tables?
I'll make a motion that we accept this this version where all 19 sites are allocated $75,000 per year for 2 years.
And Grace, and I can't see if anyone's got their hand up. Can you take the table down? So there's been a motion made that we accept the second table that was presented, which is each site receiving equal funding. Do I hear a second?
I second.
And Miles is seconding it?
And what that does is increase our allocation by a total of $25,000.
Correct.
From what it was originally.
Correct.
As well as evens out the distribution of funding to equal amounts for all the service providers.
Like it. I like
Courtney,
it.
good to see you.
If there's no further discussion, then I will ask for Grace to call a roll, please.
Liz Blackmore,
Yes.
Bob Brackett,
Yes.
Lydia Kratz,
Yes.
Betsy Fitzgerald. Betsy Fitzgerald, you're muted.
Yes, sorry.
No worries, thank you. Courtney Gary Allen,
Yes.
Pat Kimball,
Yes.
Finn Mann,
Yes.
Bruce Nodden,
Yes.
Miles Olet,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Tina Thackara,
Yes.
Chastity Toole,
Yeah.
Paul Vinsel.
Yes.
Passes.
Motion carries. Thank you very much. All right. I love it when things go through and we're moving. All right. Brendan, anything else? Before we move
Just briefly, we have, I also have contracts out for consideration with Barry Dunn for their contracting work. Later in this meeting, we'll discuss the executive committee's recommendation about the coordinator's contract. Mary and I have set up a meeting next week with Gordon to discuss the Tessa's House contracting. I think we may also be trying to reach out, Liz, to you to talk about the CAP funding contracts. And I'm also continuing to work on the Alphon contracts, the Alphon Foundation contracts and the Mayan contracts, both of which I've had difficulty getting back to, but they're very much on my front burner, and I expect to have a draft to the Finance Committee. I'm thinking really Alphond, Tessa's House, and perhaps even the CAP agencies contracts to the Finance Committee by the time of its next meeting in 2 weeks.
Excellent. Thank you. Courtney?
Brendan, super quick. Surrounding the youth contracts for the Alphon Center and the Mayan one, when do you have a timeline on when you think that those will actually go out? The service providers, particularly on the Mayan side, I think are kind of budgeting and planning for the beginning of the year.
It just to some degree it depends on how quickly we can come to agreement with them. If I can get feedback from the Finance Committee, by its meeting in 2 weeks, and those two entities I'll be sharing the drafts with ahead of time so that I can get their feedback more quickly. I don't have a target date, but I'm going to be working to get it done as quickly as possible.
Okay, thanks.
And thank you very much. All right, so we're going to, the executive committee met to discuss the contract with Mary in regards to the Recovery Council coordinator position. Mary joined us for the first part of that meeting before we went into executive session to just discuss and give us some feedback about how she saw her position going and where she, how it flowed, her workload, and some other things. It was a very productive meeting. We were able to ask Mary some questions and give Mary some feedback in regards to her work with us. And the executive committee then went into executive session. We discussed Mary's performance and discussed about her workload. It was a large part of the conversation. We came out of executive session and have two recommendations for the committee. And one is, there was some real concern about the workload of Mary, and that as much as she is due diligent and does her work, she's doing a great deal of work that is extremely time consuming, and one person can no longer handle this. And we talked a lot about restructuring the way we do the staffing here, and actually talked about, instead of having a recovery coordinator, that we would have an executive director to the recovery council with, again, possibly another staff, and then also, which we'll talk about later, a contracting out with an outside agency to help us manage our contracts. So we're talking about a lot of things in a short period of time. So in order to think this through and not jump off the cliff without the parachute, we decided that it would be in the best interest of the council to give Mary a contract up from now, well, in November, to January 10th. And in that interim, we would start the planning process of deciding, do we want an executive director? How do we want to work this workload? What does it look like with this contracted agency that we're doing? Rather than just jump and say, oh, let's make her the executive director with really no job description. So, but we also at the same time felt that Mary deserved to be recognized for her work. So the recommendation of the committee is that we extend her contract to January 10th to 2025 with a $4 an hour raise. And that we sign that, the contract will remain basically the same until January. And that is our recommendation. Then we have a second one, but I just want some feedback and to hear a motion if you agree with that.
What's the second recommendation?
The second recommendation is in regards to how we will help Mary in this decision of sort of reorganizing staff in the position. We have a recommendation. I can say that to you now before you vote on the other one, if that's your choice.
Sure, let's hear it.
Okay, so Mary and I had, after I got off the meeting, I called Mary, and Mary and I had a really long talk. We talked about her workload. And then we talked about what would benefit her. And so we thought that it may be helpful to bring in an outside executive coach to help not only Mary organize some of the thoughts of reorganizing it, but also work with the council in onboarding new membership, the new members to the council, as well as wrapping up this 2 years that we've had, and sort of have a facilitation into how do we look at that, spend some time with that. So I knew a person who is a private consultant. Her name is Sarah Yasner. Sarah has worked in the field for a long time, worked in public health, and worked with a lot of nonprofits, as well as a lot of nonprofits in substance use treatment, recovery, and prevention. So she has a background in what it was. So we met with Sarah via Zoom, and she had a recommendation for us as to how she would see the work with us, that she would do with us. And I believe that recommendation and that time frame of hers was in your information that was sent to you by Mary. Correct?
Yeah.
So
possibly an amendment, I think, to my contract.
Hmm?
Maybe amendment to my contract. Which we have to vote on.
Yeah, we did, but they wanted to hear both what we're recommending. When we signed the contract in January, then what we wanted to do is to recommend hiring Sarah Yasner to assist us for about now until, do you have
I think it would be over like a 3 to 4 month time period.
Liz,
Can we go back to the first thing, now that we've heard this second thing? So I have thoughts on the second thing, but on the first thing, I would be psyched to just extend your contract and give you the raise. You've been doing such amazing work. I think we all, it seems like the executive committee agrees with that. I agree with that. Do other people have thoughts? Can I make a motion
I'll
to,
second it.
let's make a motion to
Okay,
extend the contract to January tenth and increase Mary's pay
by $4 an hour.
by $4 an hour.
Do I hear a second?
Second.
It's been moved and seconded. Any further discussion on the extension of Mary's contract till January 10th? With the raise. Brendan? You had a question?
Just to point out, there's a subpart of the proposal for Mary, which is the council. My office has advised me that the Mary's contract will run out of money before its current expiration on November 1st. So a part of the proposal is to increase by about $8,000. I'm sorry, not about, by $8,000 the amount of funding available through November 1st. And then, the rest of the proposal is as Pat described it.
Isn't that a separate motion?
I believe that was a separate recommendation by the finance committee.
Oh, yeah, that's what I was saying. The finance committee recommended that we extend her this year's contract. But we're voting on the next contract, right?
That's fine. I understand.
So it's two different votes. Okay. Paul?
As I remember in the finance committee and what I put on the minutes was that amount was an amount that you as the chair could approve without going to the council.
I think I can only approve 5,000.
Yeah.
So
Here we are, well, let's go that, let's.
5,800. I believe I can only approve 5,000. But we need $8,000 okay, so.
Can we just make one motion that?
Yeah, we're gonna make one motion right now, because that's the motion on the floor.
Right.
Is that we extend Mary's contract with a $4 an hour raise, to January 10th. We have a first and a second.
And
Any
increase by $4 an hour. I think those two things. Okay. Just making sure.
Then we'll take up the 8,000 as a separate one. So if there's no other questions in regards to that, can you call the roll, please?
Liz Blackwell Moore,
Yes.
Todd Brackett,
Yes.
Lydia Crafts.
Yes.
Betsy Fitzgerald,
Yes.
Courtney Gary Allen,
Yes.
Pat Kimball,
Yes.
Ben Mann,
Yes.
Bruce Naughton,
Yes.
Miles Olet,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Tina Thackrar,
Yes.
Chastity Toole,
Yes.
Paul Vinsel.
Yes.
Passes.
Motion carries. Thank you very much. All right. So we'll do this one. This is a quick one. Can we vote, or can I have a motion that we extend this current contract by $8,000 so we have enough money to continue to pay Mary until the end of her contract?
So moved.
Seconded.
Been moved and seconded. Any other discussion on that?
Just a question. Why don't we have enough money? What happened?
We allocated up to a certain amount of money to spend, and we spent over it.
We had to put a cap in my contract based on the attorney general policies, and because it worked over hard.
Oh, okay, got it.
Yeah.
She works too much, Miles.
No, Miles, you don't understand that concept of working too hard.
Thank you.
All
Pat,
right,
sorry to interrupt, but who made the motion and who seconded it, please?
I made the motion, Betsy.
Okay,
And Lydia seconded it.
yeah,
thank you.
you're welcome. Any other discussion? If not, call a roll, please.
Liz Blackwell Moore,
Yes.
Todd Brackett,
Yes.
Lydia Crafts.
Yes.
Betsy Fitzgerald,
Yes.
Courtney Gary Allen,
Yes.
Pat Kimball.
Yes.
Ben Mann,
Yes.
Bruce Nodden,
Yes.
Miles Olet,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Tina Thackrar,
Yes.
Chastity Toole,
Yes.
Paul Vinsel.
Yes.
Passes.
All right, motion carries. Thank you very much. So we will now go into the discussion on considering hiring a consultant to work directly with Mary in this process. For those of you who haven't read it, let me briefly tell you what this is. So the focus is a self-evaluation for years 1 and 2, strategic planning for possibly 3 or 4, and some executive coaching. The time frame goes from November to, in November, she would start providing guidance about twice a month to Mary as she moves through this process of things from November and December. She wants to interview some of the council members and possibly some of the AGs to look at where we're seeing the work and the experience it's been to be on the council. I'm briefing this up. She's got it all written up. It's in your, or in January, she would facilitate a discussion on a self-evaluation of the board. In January and February, she would draft reports on the self-evaluation and the findings. Then we could look at changes and move on to next steps. In February and in March through June, she would, a couple times a month, whenever the coordinator wished, she would work with the coordinator, Mary, in some executive coaching. The cost of the total thing is about $7,740. She will charge us hourly, so it will be up to that amount. That's what, if you approve today, we will be approved up to $7,740 a month. And that's what, a year, sorry, for the entire contract. I apologize for that. So it's in your proposal and it's open for discussion.
Can I also add that this conversation with Sarah came after the conversation with the executive committee, and during the executive committee meeting, we talked about my role and what it feels like I need to properly support the council moving forward. And as we transition into a new council and also kind of wrap up this first real, grant application process, I think there's quite a bit that we can reflect on and learn from as we move forward. And I also think it'll really benefit the council to talk about what our mission is and our goals for the future, and to start to create a real strategic plan for what that looks like. I know for me, that would provide a huge amount of benefit, and for whoever is in my position moving forward, that feels like a huge piece around just sustainability for both this council and supporting your work. And this was something that right now I don't have the capacity to do, nor do I have experience facilitating big group meetings like that. I also think it's important that, I'm part of that and not in the facilitation role, so that I can provide feedback on what worked well and how I think we can improve that in the future.
Liz?
I'm super down with the idea of this and the description, and I guess I struggle because I know other people who are providing this service. I don't know Sarah. I'm sure she's probably great. I guess I just think I wish I know we're all busy and volunteer, but I wish we thought of this stuff ahead of time and put it on our feet, because I know John Snow Inc. is doing this work for Massachusetts and doing amazing work, and they have deep experience, particularly in helping councils do this. And so I'm a little bit I wish we had put it out for people to apply and tell us how they were gonna do it and how they would suggest doing it. And it's not to say that Sarah doesn't know. I guess I just wish we had a multiple to choose from. And that's a process that I think we all just need to decide now, hey, let's do this next year at this time. I'm not trying to derail this because you need it now and we want to do it now, but I guess I just want to say that out loud, that I think there are others that could provide us with this that may have more experience or already doing it other places that could be really helpful for us.
Yeah, and I know that it's quick. I agree that, always vetting something out is, it's a good thing. Sarah, I have worked with Sarah in the past and her name came up when all of this conversation with Mary came up. And again, we're running on this timeline, hoping that by January, we can have a lot of the work done, so then we can restructure and look at an executive director, and that time we'll have the contract and done. So again, I agree that, that it's always better if you send it out and interview. It is a matter of timing.
Yeah.
And again, as expressed in the executive meeting, Mary's job really is, it's overwhelming at times, where I'm very grateful to have her. And this also gives her the opportunity to have an executive coach, so she can get feedback and about, working through things, and it just seemed beneficial. So again, I get that. I'm asking today if you will consider this, and if not, again, it's up to the board. I can't see hands, so Paul, and then I'll get people on Zoom.
Mary, have you met Sarah?
Yes, over Zoom.
Are you comfortable working with her?
I do feel comfortable with her. Yeah.
So what is she exactly going to, one more time, she's gonna get like ideas from the council of how our experiences were and then coach Mary on what exactly?
On redesigning and looking at an executive director versus a coordinator, what does that job description look like? How does Mary see it? How does the board see it play out? She will ask those questions. We'll look, rather than just jump and hire somebody to help Mary, we sort of help Mary look at work. Is it more administrative pieces that she needs? Do we need a coordinator and executive? How, exactly what are the needs, rather than quickly say, oh yeah, Mary's overloaded, we'll hire somebody.
Right.
Hire to do, again, so this person will sort of help Mary sort of solidify how that works, and then Mary, of course, will bring all of that for us. Mary, also, we've had a lot of conversations. We've talked about looking at where is this board 2 years now, 3 years from now, where's the strategic planning, where is any of that? And we've always been on screech and really never taken the time to really look at that. I think about, onboarding new people to the council. I don't even know, how do you do that? Who are we? We have bylaws and we've done extremely amazing work in 2 years, but there's a whole lot more that needs to be done, particularly around futuristic looking at how this board looks like in 2 years, 3 years, 4 years out. And that's what Sarah is basically starting that process, as no one really has the time to do that. So she will really sort of kickstart that. Questions? I can't see hands, so if you can take that down, so I can. All right, Ben, thank you.
Thanks. I'm generally supportive. I would echo what Liz's comments were as well. I do think a lot of people could do these types of services and but understand the need for immediate support and more infrastructure here at the Recovery Council. I think I think about things in like operations and procurement terms, as you all know, and like $7,000 is a low dollar contract. So doing it this way, I'd be comfortable with. Anything like over $10,000 or maybe slightly higher, I'd want to allow more people to offer their services. But I think I'm generally comfortable with it. My only amendment, and I only looked at it for 5 minutes, but the proposal we might want to work some language into the contract that allows us to extend the contract slightly. I don't know how busy we are going to be in the January council meeting, for example, with grants and trying to make decisions around that. So I wouldn't want to have this, we need to take the time for self-reflection and make sure we're building something sustainable here, but we also have immediate work to do too. So we're gonna have to balance those things. And I would just if January doesn't work, I think we would want the flexibility to push out the self-reflection and sort of the strategic planning work a month or 2 or 3, as opposed to being forced to do that. It seems like that contract talks about that she gets paid regardless if people show up or not. So I would want at least some clearer expectations in the contract around that.
Thank you. Nice suggestion. Courtney?
So I feel really uncomfortable with this. I don't know. I just feel like it came up really fast, and we didn't talk about this in the executive committee. And I don't feel comfortable just like picking, and she's probably wonderful. I don't know her, and I don't feel comfortable just picking a random person to do this. Also, I'm curious about the timeline. Is she thinking that she would interview, like do these meetings with this council or with the new council? Is she going to interview old council members? I just don't understand how the process is going to work.
The understanding was that she would do both. Because to look and reflect back on the last 2 years, she can't ask a new counselor, a new council member. She would actually ask to meet or speak with people that are on the current council. And again, I apologize. I know it was fast. It was Mary and I were, talking, and we were thinking, how do we make this work? And so Sarah's name came up. So again, she's someone I have worked with in the past. So I said, let's just look and talk. And we talked to her and met it and said, again, I don't know how to get the work done by January for an extended contract without some support from Mary. I don't know how you do that. So this was a suggestion. Gordon?
Yeah, it's interesting. But I think some people are interested in knowing that I do think we know Sarah a little bit, because I knew I knew the name, and I thought she'd been one of our options liaisons, and if she wasn't a liaison, she was in at Bangor Public Health.
Yes.
Supervising some of our overdose prevention, overdose response work, because I knew I recognized the name. So to me, that's positive. I just Googled her, and she received a reward for her recovery work. That's a positive because she knows something about our work.
She wrote a MEHAP grant and was involved with recovery coaching,
Right.
the MEHAP grant for the barn. And again, that's how,
Right.
and again, she was with Bangor Public Health, and actively involved in syringe exchanges and all sorts of things with Bangor.
So, I mean, I think I'm following up on what Ben said, that I'm troubled by the fact that we met in the executive committee and the focus was on Mary's contract, which it should be. And this is really quite different. I mean, this is like a board evaluation, but given that we're new, given that we're small, given that it's a small amount of contract, I trust Mary enough and the chair, honestly, that if they feel that this is helpful, there's little risk in it. Honestly, it's the way I kind of feel, and that we got so much to do here. I'm really anxiously awaiting the prevention work group recommendation. So I'm going to support a motion to do this, but I wanted you to kind of know where I was coming from.
Bruce and then Miles.
Yeah, I'm not necessarily against this recommendation, but I feel like in the executive meeting, we determined that Mary's workload included duties that were not necessarily just for an executive director, and just giving her $4 an hour extra does not reduce her workload, nor does giving her a title of executive director. My concern is, how does this help her with attacking that workload that she has, which is administrative along with executive, and how are we ignoring that? That's just a question.
You want to answer that? You want me to? So part of the conversation was to sort of organize ourselves. So this person would actually work with Mary as she organized what a job description would look like for an executive director, be able to bounce off of her how she saw the work going and the workflow. Is it more administrative? So she would have somebody to be able to have those conversations with, as well as get the feedback from the council members as to how they saw that. I mean, you have some wonderful strategies that we did and priorities, but you really don't have any strategic planning about where we see ourselves in 3 years. You know, that there's a lot of things that come up quickly. And so, again, I hear you saying that a lot, that we did not have a discussion of hiring a consultant to help her. But it's basically what they call an executive coach. And what they do is they assist Mary. Mary technically doesn't have a supervisor. She has 15 supervisors. I mean, I meet with her once a week for an hour and a half. But I have the time to do that. You don't know whether the next chair of this council has the opportunity to an hour and a half a week and be able to get feedback from Mary. This gives Mary an opportunity to be able to organize that workload and to look at it clearly and to make a clear recommendation to the board as to how she sees the staffing go. Miles, then Ben, then Todd.
Yeah, Bruce kind of said some of what I was thinking, and Sarah is awesome. I've worked with her before a little bit. I'll be honest, I've never made $120 an hour in my life. And to me, that's a lot of money. I know 7,000 doesn't sound like a lot in the grand scheme of things, but for $100 or $120 an hour to like get feedback from the council, like that to me doesn't seem realistic. To try to strategic planning, possibly, yes. I thought maybe that's something that, and maybe I'm wrong, but maybe Barry and Dunn would be doing as part of like what they were doing with us. I don't know. To me, that just seems like a lot of money. And maybe again, it's just me. But that's where I'm at. But I like Sarah. I've seen her work, does great work. I want someone to support you. But I don't know, again, I mean, if you're telling me what she's going to do and this money will really help push us forward, then I trust your judgment. Again, to get feedback from everyone and whatnot, and I don't know, that's a lot of money to me, but that's all.
It would be to me, but in her world, it's a bargain. Ben, Todd, then Liz. And I am gonna somewhat limit this conversation if we can't move it forward. I'm going to have to table it, unfortunately, because we have a lot on the agenda. So Ben, Todd, Liz.
Thanks. I don't know if I would characterize it as a bargain, but I think it is probably the going rate. I wanted to ask about how does this have any influence on the Barry Dunn contract?
No. It's
Okay,
not.
so we are still moving forward with a contract with them or a additional support to help with grant management and contracts and everything, yes?
Correct.
Yeah, specifically with grant management. The last sort of service they're planning to provide us or that we talked about is a training for the grant evaluations.
Okay. I just wanted to make sure that this didn't replace any of that, because I see value in the executive coaching part of this. I do think like strategic planning, and we just need to carve out time to do that. I think I'm not sure this, like in two council time, that the strategic plan, this is going to add to our workload, including Mary's, I think, for part of it. Except so maybe maybe we go forward with the executive coaching piece today and sort of discuss further the strategic planning and self-reflection and where we want to go. I think we need to have that, but maybe that could involve a little bit more discussion. Just another option, I think.
Thank you, Ben. Todd.
Yeah, I just want to make sure I'm clear in my understanding. I kind of to Bruce and Miles's point. It's my understanding that part of what she's going to do is actually help Mary look at this ED versus her position now and what we may need for additional staff. So rather than us just deciding on our own that we're gonna, that Mary needs help. Is that right?
Part of what you did, yeah, part of that is, yeah.
Thank you.
Thank you. Liz?
I'll just say, so in terms of price, totally the going rate. We hire consultants all the time. They have to pay for everything. It's not, everything else is included. So 120 is totally, it has been reasonable rate in our world. I also think, like, I don't love this process, but I also think we're in this position where I really, like, if we just prolong it, then what? Now you're just like with more and more work and not enough support, and we need to make decisions about reorienting how this works so that we can have more staff. So I'm not into this, to be totally honest with you. I think we should, but we all are volunteer and we need more staff to help us then in the long term be able to write an RFP for somebody to give us the services that we need for strategic planning. I don't know that I'm psyched to have her do strategic planning. Is this strategic planning around what we're gonna fund, or strategic planning around our structure? So I'm down with the structure part and the infrastructure of our council and how that is. I think I would want somebody who's done strategic planning on substance use and knows how to do this, because I haven't been psyched at how it's happened, and I would love to have somebody who's like really, really skilled at strategic planning on what we're gonna fund. In terms of structure of this organization and how we operate, I'm fine with this, so I will support it. Even though I'm not psyched about it, I will still support it because I want you to have more support, Mary.
Well,
Are you ready for a motion?
Wait, Courtney.
sure. Oh, wait a minute, Courtney's got her hand up, and then, well, you can make your motion and then we can second it.
I'll let Courtney go first.
Okay, Courtney?
Just super quick. So I agree that we need more staff. I guess I'm struggling why we don't just hire more staff then. Like if the problem is that we don't have enough capacity to do the work that we need to do, why don't we just put together a position description and hire an executive director who can do that work?
I think the thought was, we really don't know what that is. So this gives Mary someone to work with to sort that out. So Mary can really deep look into the work that she does, what would become the work of the executive director, and exactly what the other position we'd hire looks like, what that structure looks like. We don't know what that is. Right now, you can say, I'm gonna hire somebody to do what? To do administrative work, to do coordinator work, and then if you have an executive director, what would that work look like? So that's what the thought was.
I'd like to refer that somewhat to Ben, because it's my understanding that the way we're structured, you have to have a line item in your budget to be able to have a position, and then HR is involved. I mean, I understand why we do contracts and not try to hire people. It's a great question, Courtney, but it's my understanding the way we structured, that would be a nightmare that makes the present discussion look honest.
Yeah, we're not.
So I'm sorry, let me, why don't we contract with somebody to do the executive director work? I apologize. I did not mean
An employee.
hire. I didn't mean that in the sense of the legal term.
That,
So I make a motion that we contract with Sarah for executive coaching and for strategic planning on the structure of the Maine Recovery Council.
so can I clarify that? I just want to make sure. So you're making a motion that we hire Sarah, we contract with Sarah to work with executive coaching with our recovery coordinator, and then she work on the restructuring or the board, but not the strategic planning piece. Because Liz had said she would prefer that be sorted out at
And
another time.
I agree that I don't want someone that we don't know making decisions of how we spend our money.
Yes.
but on the structure and how we work as a council.
Okay. Okay,
Yeah.
all right, and can you say that you approve a contract?
Well, you have to put it back up so I can
Yeah.
read the numbers.
Well, the number, well, that contract may be renegotiated because part of that has strategic planning in it.
Okay,
So can you say up to the amount of that and no more, but it may be less?
so up to $8,000.
Okay. Do I
Super
hear?
quick, super quick, I'm sorry. Is this something what the AG funded, the center that the AG funded could help with, like a structure plan for funding, for getting this money out?
No,
Okay.
they're into the dashboard. They're into helping us with examining if our work is making an impact, but they're not into this kind of executive coaching.
Can I chime in for a second? I
Please.
think I completely hear where the council's coming from, and what feels the most important to me, within the next month and a half, is that we dedicate time when this council is still around to talking about what the past year was like, specifically with the grant process. I'm worried about us getting too far away from that and then not having a good time to reflect and improve moving forward. And bringing in somebody to facilitate that conversation felt important because of how involved I was and Pat was, and wanted to have that open discussion. I hear the council though, if we want to talk more about what our needs are moving forward and what that strategic planning could look like, I mean, I'll continue to do the work either way. That doesn't change. So I just want to mention that because, again, the conversation, the immediate conversation feels most important to me. And if we need to discuss this later on, that won't have a direct impact right now on my work. I also think I know what I do every day. Makes sense. Thank you.
We have a motion. Do we have a second?
Second.
And Lydia Kraft has seconded. Do we have any more discussion? If not, can we call a roll?
I'm sorry, what, are we voting on the contract that is our inbox basically, including strategic planning or not?
Voting on, we're going to amend that contract with not the strategic planning in it. So, but we're gonna, because I don't know what that's gonna look like, so I wanted just to have, the contract actually may be less because we're pulling that part out of it. So we're voting on just that she will do an evaluation, a self-evaluation of the board, of the council, and to do some executive coaching with Mary to help her through this process. So that will be pulled out of the contract. But it will, that if you agree, yeah, that's the motion. Brendan?
Yeah, I wanted someone to repeat the motion so that I could understand it. So, and it's what again, up to $8,000 to do executive coaching, and what was the first part?
It will be to, looking for her word to me. It'll be to work with the board, in facilitating a discussion, and plans around what's happened in the past 2 years, and some suggestions for us to move forward with the grant. That's what will be in her contract.
And so we're going to solicit a new proposal from her. Is that right?
Yes.
And what part of the council will review that proposal?
I am assuming that it would go to the executive committee.
So so it sounds like we should schedule another executive committee meeting.
Yeah,
Don't we have one scheduled?
executive, we have a governance.
Right.
If you want the governance committee to do it, they have a meeting
You
scheduled.
have finance.
Huh?
You have finance.
We have a finance committee meeting scheduled, we have a grants committee meeting scheduled, and we have a governance.
Same people on governance and executive?
No. Well, I have a motion and a second. Brennan has a question. Again, I don't know what the answer is to that. Thoughts? I guess that you'd have to change the motion to say that the contract couldn't be signed until it was reviewed by the executive committee or governance committee.
Todd, you were trying to speak.
I think I would, I would want, some body of the council to approve the proposal. Once that's done, then, we can go forward with contracting.
So perhaps we use the committee times to reconvene and talk about what it is exactly we're looking for and what we need moving forward, and then we can bring this to the next council with a better sense of the scope of work after discussion.
That's just the last meeting of this board. The November meeting is the last meeting of this board. Okay, let me think, Sir Bruce.
I'm glad to go, but I think Todd was trying to talk. He was unmuted, but he wasn't coming across.
Got it, Todd?
Can you hear me now?
Ken?
I was just suggesting that I agree that it should be reviewed. It seems that it started at the executive level, executive committee level. I personally would be okay if Paul was willing to modify his motion to say that it needs to be reviewed by the executive committee.
I will modify mine to say it should be reviewed and approved by the executive committee.
And
I second that.
And Second Craft approves of that amendment to the motion. She seconded it.
Thank you, Todd.
Any other discussion? Can you call a roll, please?
Liz Blackwell-Moore,
Yes.
Todd Brackett,
Yes.
Lydia Crafts.
Yes.
Betsy Fitzgerald,
Yes.
Courtney Gary Allen,
No.
Pat Kimball,
Yes.
Ben Mann,
Yes.
Bruce Nodden,
Yes.
Miles Olet,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Keenan Thackrar,
Yes.
Cassidy Toole,
No.
and Paul Vinsel.
Yes.
Thank you very much. Motion carries, and we will get back to you with the executive committee. Thank you very much. All right. Coordinators report is going to be a combination of the coordinators report and the program grants committee meeting because Joe is on vacation.
Great, thank you. So I know we don't have too much time, so I want to focus on the grant evaluation criteria, because that's something we need to confirm before the end of the month. Grant applications, as a reminder, are due October 25th. I'm working to convene a group of external evaluators, as we kind of briefly spoke about last month. And my recommendation is that we create a sort of ad hoc evaluation committee to provide recommendations on the grants, similar but also very different than the ad hoc prevention work group. Those external evaluators will work alongside Recovery Council members to evaluate applications. We'll do that all through the online platform that we have. It will happen independently on your own time. Hopefully the goal, and will do my absolute best to make sure it is not the same time commitment and requirement as the letter of intent. My hope is to keep it under 10-ish hours or around that for everyone who's involved. And I'm working with a couple different organizations to see if we can recruit some of their evaluators. One component that I need clarity about from the council is similar to the letter of intent, where we allowed evaluators to be involved even if they had a conflict. We just made sure they weren't scoring anything under that same pillar. I'm assuming that that's the structure we can have moving forward with the grant application, but I don't want to make that assumption and then have that be incorrect. So are you all comfortable with us having evaluators involved and members of the council who potentially had grant applications they submitted, but they won't be involved in the scoring of those, of the same pillar?
Bruce?
So they could score other pillars?
Yes.
Yeah.
Yeah, similar to the assignments with the LOIs. I think you have one for all of them. No.
Bruce and
I don't
then,
know, I didn't score any.
yeah, Bruce and then Todd.
Yeah, I just want to make sure that that there's a reevaluation of those scores. And I'm bringing this up because I think there may be some conflicts of interest that may have come up since the last time. And make sure we reevaluate folks' conflict of interest currently.
Yeah.
Thank you for putting that out. Todd,
Can you hear me?
we can.
Two questions. One, and I apologize. My last month has been really crazy. I missed a couple of meetings. So is there a list of who was asked to apply? Because I don't remember seeing that. Actually, that's not been formulated yet?
No, we don't have a formal list. I've been reaching out to organizations to see if they have, potential evaluators who work with that experience.
Sorry, that wasn't my question, Mary. Do we have a list of who we've invited to apply for a grant?
Oh, yes.
After the, I haven't seen that. I'm sure it's out there. I can probably find it on the website. I apologize. I didn't see that.
We have a list of who's applied. When we went through that, it was all made anonymous when we did the evaluations, and we haven't made that list public yet.
Right. So then I'll go back to the original question. I didn't like the fact that we weren't able to do LOIs in the pillar as long as there was no conflict of interest. I don't like being excluded in the grant review process either. So I can understand if there's a conflict. We've all signed that agreement, understand it, and I'm supposed to make those disclosures, but I don't see. Yeah, that's just the way I didn't support it last time. I don't support it this time. I think we should be able to review things in a pillar if we don't have a direct conflict.
Okay, thank you.
I was just gonna say, I think because we've kind of set aside dollar amounts for each pillar in that way, it's like the pillars aren't necessarily competing against each other. So I feel really comfortable with people who have a conflict in harm reduction being able to read for the other two pillars. And think that if we exclude everybody who has a conflict in any pillar, we won't have very many people on the council who are able to review any of them. And we're supposed to be deciding.
Yeah.
So it feels like we have to come up with some way to have people who have a conflict in one pillar to read them, because otherwise, who's gonna read them? And then we're not deciding. So we need to be deciding. I think Brendan's made that pretty clear. That we have to have the most decision-making power as a council, because that's what we were put here to do.
Paul and then Courtney.
I'm a little bit confused on what Todd is asking for. So I'll give a specific example. I am employed by someone who is going to be making a grant application in the treatment pillar. So I would want to exclude myself from evaluating any grants in the treatment pillar. But I would be comfortable evaluating grants in harm reduction, prevention, or recovery.
Correct.
Is that right?
Correct. And what Todd's saying, he thinks it should be open. And again, I think it can also be personal. We could say it would be fine. For me, if I had in a pillar and I was applying, I could tell you if I had a conflict, I wouldn't want to be in that pillar either. What Todd and what Liz are saying is it probably needs to be, because a conflict of interest is not just a clear cut and dry. It's about how you perceive it yourself. And if I perceive it as a conflict, it is a conflict. That I won't go in scoring ethically or because I'm in direct competition with it.
I actually think Todd and I are not agreeing.
Yeah,
I think he
you're-
wants to,
yeah.
he wants to be able to read anything regardless. I don't want that. I
Oh,
think,
I thought that's what you said.
no, I'm saying if I have a conflict in the treatment pillar, I should not be able to
Oh,
read
okay,
in the
I
treatment pillar.
misunderstood you. Okay, thank you.
No, I'm
Okay.
saying that we need people though to be able to, because I think you were asking the question, if you have a conflict in one, can you review in others?
Correct.
And I'm saying, yes, you can review in others, but not in the one that you have a
Okay.
conflict in.
All right.
So I think
Same as the
Todd and I
LOI.
are not.
Yeah.
Same as the LOI.
But
Okay.
Todd, I do hear what you're saying. I need to send out another list of who's been invited to apply to submit a grant. And so you all are aware of the organizations who intend to apply.
And
And
if I
who-
could, and if I could just clarify my point, it's not that I want, I understand the conflict issue, right? But using Dr. Benzel's example, in a pillar where he has a tremendous amount of expertise, you know what I mean? It's a shame that we can't figure out a way to allow him to participate in reviewing. I would say the same thing for Liz. I mean, a lot of you folks have special, have a lot of experience in those areas where I think your opinion is really important. It's just too bad that it has to be excluded across that whole pillar. If there's no other way to do it to ensure that, that people are being non-biased, I guess that's the way it has to be. It just seems like a waste of a lot of talent around this table.
Yeah.
Yeah, I agree with you on that
I
one.
understand
Al.
that.
It is, it's unfortunate.
Yeah. Courtney, then Gordon.
Just a quick point of clarity. Liz, I think I heard you say that we had allocated money to each pillar. I was just wanted to make sure. I don't think we did that. Did we do that?
I think we haven't allocated, but we've been pretty clear as a group that we wanted to do 4 million, 4 million, 4 million, that we were generally trying to get to equal amounts in the pillars. We've been saying that all along. If that's not what people have been saying, maybe I misheard. That's what I thought people were saying.
I thought that's what we were saying, but I also was some comments, like if there was a higher priority and one that we could shuffle a little bit, and maybe 5 and 3, if there was, a higher priority and one project sounded great and it's going to save lives and it's going, you know what I mean?
Yeah, I don't think it's like hard and fast, Courtney, but I think we generally were saying we were trying to keep it to that. So in that way, I just feel like that's why I'm saying I don't have a problem with people being in other pillars.
Yeah, I think we didn't vote on it deliberately.
We didn't vote.
I think it was a consensus that we would do that with the caveat that if some program came in and was gonna go, over, we would certainly look at that.
Treatment costs.
Okay, thank you, everybody. It's really hard being on Zoom when other people are in the room. And so I'm sorry if I just am having a hard time situating myself in the conversation, so I just needed clarity. So thanks for doing that. My question, Mary, can you repeat or say for the first time, who's doing the grant scoring? Is it members of the council and other people that haven't been identified yet?
Yes, it's both. And I'm working to create that list and have a couple people who seem to be on board, who have past experience evaluating grants, who are willing to participate in the evaluation process and volunteer their time.
Okay.
What was the timeline on reviewing them? Sorry.
I asked to make sure they were available the first 2 weeks of November.
And those folks, so they're gonna be briefed on our priorities, what is.
Yep.
I know they say it in the grant and whatnot, but just, it's been so long since we've actually even discussed them. I just wanna make sure that that's still, what we're looking for as a council, what's needed in the state. This is the most important. This is our goal, what we're going for.
Yeah, definitely. There is, I've already confirmed with Mary Dunn that they can lead a bias training, similar to what we did with the grant. And as part of that, I'll include an overview of the grant application and the evaluation, which will be recorded. But everyone who's evaluating will be asked to participate.
Okay. And so is the question, Mary, is if those outside scorers can have a conflict in one of the pillars and be allowed to score in the other pillar? So if
Yes.
Joe has a conflict in treatment, can he score in harm reduction? That's made up.
Yes.
Okay, I'm fine with that, except I don't know how how do people get on that list to be scorers?
It's from me reaching out to foundations that we spoke about last meeting, to see if we can essentially recruit their evaluators that they have worked for them.
I think
Throughout
she's
the
asking
country.
about, are you asking about the council members, Courtney? I think she's asking about the 9 to 10 council.
No, I'm asking about the outside facilitators, outside scorers.
Got
What
it,
we
sorry.
do is ask some of our partners if they have some recommendations for people that have done grant scoring before, and that's where we were gonna first go. And see how many people we could get from there.
Yes.
And then if we still needed more, then we'll have to come up with another means to do that. But right now, we're looking at MEHAP, United Way, and some other organizations.
John T. Gorman, Maine Community Foundation.
Maine Community Foundation, Gorham.
And are we gonna get this list of folks before we,
Sure, we could do that.
I mean, I don't know if we need it or not, I'm just curious. I have no idea.
Well, they'll have to also go through, presenting any conflicts, and they might need to sign. I'll talk to Brendan about what they need to sign, but I can provide that list to the council.
Okay, thank you, Mary. I think I figured out what I have a value being triggered today around both of these issues, the one I just voted against and this one too. And I think it's the value of transparency. And I'm feeling like these two things, like how do people get access to them? And it doesn't seem fair to me how people are getting access. And that's where like my hesitation is coming from. And I'm just saying that because I felt like I needed to say it. But I will set it aside to just make the thing go forward.
Gordon, and then Liz.
Okay, in rapid succession, is there any objection, Mary, to people who believe that they have scored before and would like to be considered for them to communicate with you? Is there any problem with that?
Who have scored.
Well, is there any objection to people who believe that they have experience in this field beyond the organizations that you've reached out to? Might they communicate with you and volunteer? You don't have to accept them or not, but in the interest of Courtney's point of transparency, is there any problem with that?
No, I don't see a problem with that right now.
Good, okay.
As long as it's not a cast of thousands now calling.
Well, my second question was gonna be, how many external evaluators are you looking, roughly are you looking for?
15 to 20, but the longer our list, the better, because we don't know how many applications we're gonna receive. And so I want to plan ahead and at least have the support if needed.
Okay, so I was moving to that. Has you've already done the invitations to the group. Have any of the projects yet communicated back to you that they don't intend to apply?
One
Well, okay.
out of 160.
Well,
Is that my one?
Yes, and Paul told me that this morning.
So I'll put that public. I got a call, email from Dr. Eric Steele. The 1,000 Lives campaign has been funded by the Attorney General's office and will not be applying for a grant.
Right. I think if yeah, and just, I am anxious to see the list of the projects, because we've never seen that list. And you say that will now be available to us, partly from you, partly so that we can rule out any conflicts that we might have.
Yes, you'll see the names of the organizations.
Great. I'm done. Thank you.
Thank you.
I guess one question I have is just for sort of like in the final moments, okay, so we have everything scored, there's numbers. There's comments, there's numbers. Are we deciding as a group that then we decide?
Yes.
That we've been given information from these outside people, they've scored, but we don't but we then have ultimate authority as a group
They don't have any authority, only
to
us.
decide. And can everybody vote on those final things and exclude themselves if from the vote of their one project, if
Correct.
they are, but not the pillar, but their one project,
Yeah,
we go to final vote.
It may be tricky because again, we'll just see how that lays out. I mean, the intent is that everybody votes in. But again, if there's 166 people applying and then you pick so many of, you don't want to vote 25 times, but we may have to, but we will do
Well,
that.
it's more that I want to make sure that we are clear on what happens at the end so
Yeah.
that I can feel comfortable with having outside evaluators, because I know in the end, this group is gonna make the final decision. So I think I just needed to know that to feel comfortable with this process.
Unless somebody had another thought, it was always in my thought, and I believe Mary's, that the outside evaluators were strictly going to score it, put their comments on it, and then pass it over to Mary. The ultimate decision on who gets those dollars and how that goes out is the members of this council.
Yeah, it'll be a recommendation.
But
But that means
how,
we're voting on every single individual grant, I think. Is that right?
Well, it depends on the conflict of interest. Because if you voted in a whole slate, say you had 10 of them, and 9 members of if you voted on 10 at once, and 9 members of the council all had a conflict, then you wouldn't be able to vote. So it will depend on how it lays out as to how the vote will go, but the ultimate decision is this council.
So since we have the ultimate decision after, does that mean we all are gonna end up having to read all of them anyways?
Yeah, I guess that's exactly my point, is that if we're not voting explicitly on every single one and we have outside evaluators, I just want to make sure that we're not going to have to review the work of the outside evaluators again and then take another vote, because we want to make sure that the council's making a decision on the grants that the outside evaluators are scoring in the first place.
So my guess is.
Does that make sense?
Mary will do similar to what she did with the LOIs. She put up there where the top scorers were, how that worked, and then you will make up your mind. And you may say, I don't understand, that was so low, but again, I don't think.
We didn't come close to, we didn't vote on individual LOIs. We excluded a chunk of them at the bottom and then voted in 160 in a block no one reviewed every single one except Mary.
Correct.
So I do think we need to talk through the process here a little bit more, because it's complicated.
So most boards, and again, I'll use either it's MEHAF or whether it's United Way or whatever, they use external evaluators, they're scored, and it goes to their boards for review. Those boards don't read every score. They take it that the scorers, you'll pick, your top scorers and say, these are the ones that, this is how the scoring went out. I can't even fathom all of you reading every single one.
But we may have a top 20 that we want to read.
Exactly. You may have it.
Sorry, Courtney.
Correct. Yeah. Courtney?
I'm struggling to understand in that scenario, Pat, and maybe you can help me understand, how that is not superseding the power of this council to outside evaluators.
All they're doing is scoring it. So
Right,
that's.
but then they come back to us with their average scores and we vote in the top scores. So that's.
We didn't say anything about average score. I don't know how that's gonna go. All I know is the grants that I review in other places, I score them, I review them, I hand them over. I am in no way a decision maker.
You are one part of the scoring committee in a decision-making process. If then the council just
Correct,
votes
and then
in.
that those go to whoever the coordinator is that coordinates the grant process. And then a board determines whether how they do it.
Okay, so that's superseding the power of the individual council members to a scoring committee. which is fine if that's what this council wants to do, but that's what it is.
I don't see it that way.
Well, I think what Ben is trying to say is we need to work it out. What
Yeah.
is the process? And I agree with you, Courtney. Let's work out what is the process.
Yeah.
Like, because there are other ways to do it where we say, okay, we have scores, which include us, and we have to manage top scores with dollar amounts, right? We're gonna have to do some sort of rubric where we understand, say there are the top 20, or let's say top 10, equal the amount of money we can give out. And maybe we wanna all read the top 20, like maybe there's some way, Courtney, where we split the difference, where we have an initial scoring round, there's 160, I wish we had gotten rid of more LOIs, but it might be easier to get rid of a whole bunch on the bottom that we don't feel like meet the requirements and that have pretty low scores. There might be middle ones with middle scores, and then there might be a tier at the top that, yeah, then we're all gonna have to read them. If we don't wanna supersede the powers, then we're all gonna have to read them. And I think we just need to account for it and put it into the process so that we do that, if that's what we're gonna do. Because I'm with you, I don't wanna give out away our powers, but I would like some culling. Because I don't wanna read 160 and neither do you. So like, how do we
Well-
cull? Go ahead, Dan, say it, sorry.
I didn't mean to interrupt, but I agree with everything you just said. And I also, there's a throughput issue too. We're not gonna be able to put forward 160 or several dozen contracts at once, even if we have a full a vendor on board too. So we might want to look at the top ones and vote to approve those, and then come back again and look at the second tier, because, approving 3 dozen projects up top is we literally can't get all those contracts in place at once. So we might want to prioritize some too. There's a lot of different permutations here that I just think we need to talk through the options.
So if I can make a recommendation, because I'm a little concerned about time, if I can make a recommendation, is one, that we take this conversation to Grants and Programming Committee and let them sort through how this will work, and then bring a recommendation to the council. I think they meet in a couple weeks.
They meet on the 29th, and at that point, we'll know exactly how many applications we've received.
So let Grants and Programming sort of look at that as to make a recommendation, how we will do this in a fair way that does not undermine the power of this council, the decision-making process of the council, and then bring it forward. Does that sound okay with people?
Does that timeline work?
Yeah, the
Well,
timeline doesn't work. Then this group isn't making the decision, right?
Well, you're not, okay, so. Yeah, I don't know how to do it.
If we do wait to the Program Grants Committee, essentially the training will need to happen the day or two after, and then I'll have a weekend to get everything finalized, assign all the grants, and then we'll have 10 days to complete the evaluations. And then I have 3 days to wrap that up every time.
So the Program Grants Committee would have to be making a decision that's final without going back to the council, because we need to come back to the council to actually vote on stuff on the
Can
11th.
we have another council meeting?
Yeah, can we put another
Is that-
council meeting in
Is
there?
that like,
Sure,
I mean-
would love that.
I mean, we're just at
You
the
can
end
have one
here.
in,
We're up-
you can have one in 14 days.
We're up against a tight timeline here.
I wouldn't mind another meeting to figure it out and it not be super rushed. But at the
Okay,
same
then,
time, I know-
we'll have another meeting and we can do it, well, we can choose to do Zoom if we want to, so people don't have to travel. So we can have another meeting in 2 weeks to discuss and the only item on that agenda for that meeting will be the grant review process.
What is everybody else's thoughts? Zoom, Mary, does that mess with you?
Well, I'm wondering if it would be better to wait until after the 25th. Maybe the Program Grants Committee can serve as that meeting, and then we schedule 2 meetings in November.
Can you reschedule a meeting?
Could everybody just go to the Grants and Programs Committee? And that's a full council meeting?
And we decide on the evaluation process then, once we know exactly how many grants we have.
Like
Yeah.
it.
That
Like
sounds
it.
good.
When is the grant?
October 29th.
October 29th.
3 to 5, correct?
Yeah, all right, so the consensus is that we will vote on this as a full council and commandeer the grants and program committee time in order to do that.
Okay, one more question. I know you're like trying, and Mary, in the meantime, between then and the 29th, anyone who feels that they have the expertise under one of these pillars can contact you and say they want to be on the list as an outside evaluator.
I'm looking, the way that I've been approaching this is looking specifically at people who have experience evaluating grants, not necessarily subject matter expertise. I see you all as subject matter experts, and we're looking for people who have experience with grant evaluations, so they can look at a grant and know the viability and feasibility of a project beyond just what it is they're proposing. I guess having that kind of outside perspective of this proposal can succeed based on what I've read and approach it in a more unbiased way. And then you all serve more as the subject matter experts.
Okay.
I can change, but that has been what I've been looking at, given that some of you have reviewed grants before, but not everybody has. So that.
And remember, you're talking about close to 35 people, maybe 40 people that are needed. And so we, again, there can be, how do I say this slightly, some hand-holding, but not a whole lot, because we just don't have the staffing to do that. So if we have people who have experienced grant writing, for the most part, they know the general lay of the land. They don't know our specifics and the way that our program works of how we're looking for, but they have an idea, they've done it before. And so, again, but it's up to everybody, it's not up to me. But
part of what I'm also hoping is that, well, my intention is that when that list of evaluators is presented, you all will know their qualifications and their experience. And at that point, you all can make the decision about who's involved in the process. Does that make sense?
okay, so for the sake of time, we were gonna vote on the rubric. Do you want to wait for the grants committee meeting to vote on this rubric? Or are you comfortable with, you've got the information now, voting on this and moving it forward? But if you want to have a real in-depth discussion, you're gonna have to move it. Because we have some other things that we need to vote on, and plus we have a presentation coming up. Consensus?
To me, it feels like this falls into what the next meeting is about anyway.
It's fine with me, then you can vote on it on the grant rubric at the committee. Is that gonna work for you?
I don't know. I think so. Yeah.
Okay, thank you.
If we have time at the end, maybe
Yeah.
we could take a look at this.
All right, anything else? We'll move on to Ben and then.
No, that's all.
Okay, so the next two items are important for us to move through, and I'm trying to give enough time for 45 minutes for the presentation on prevention. So Ben, I hate to do this to you, but I think you have two important items to talk about: the indirect cost policy. The draft has been with, and also the RFP contract for grant services. I think those are both on that finance committee for votes.
I have the first one. I don't think I have an update on the RFP for grants, but I could be forgetting that.
The RFP was sent out to everyone.
The RFP was sent out to everybody.
Great.
Which I think what would be helpful is if we can get, so that RFP was presented to the finance committee. I made some revisions based on that conversation and after talking to Chapter Cutler Institute. So the draft that I sent you is more or less a final draft. We still have to finalize, the time period that would be open to receive applications, where exactly it would be hosted. Katrina and Grace have been helping me figure that out with the AG's office and all of that. I think what we would need here is a vote for finance to officially approve that, so it can be published at the beginning of November. That makes sense. Ben, are you okay with that?
Yeah, we could take that up at the finance committee on the 28th. And if I've reviewed that. Apologies, it wasn't at the top of my mind right now. I'm not sure if other finance committee members have, but we can finalize that and move that forward based on finance committee recommendation if the council is okay with that. That is basically grant support and contract support for a larger vendor to help review and manage and monitor all the contracts in the grant process, correct, Mary?
Yes, yes, exactly.
So everyone's comfortable with that, we'll let Ben go on with his finance committee. And the only thing we have to vote on is the indirect policy.
Yep, so the most recent finance committee, we covered a lot of ground. We've covered some of it today with syringe service provider next steps and RFP that we just talked about. The major piece that I'll talk to you about now is the indirect rate. Recall that we originally had a recommendation of just defaulting to the de minimis indirect rate for providers. The council rejected that and referred it back to the finance committee last council meeting. Finance committee took it back up, and we have discussed further and are comfortable and recommend that providers can use their federally approved rate or an alternative rate like the de minimis rate or a negotiated rate that might be separate from either of those two to include in any awards that they receive from the Maine Recovery Council. So again, that would be, this is for the indirect rate. So it's basically for unallocated costs that are typically, for example, the corporate governance of an organization like the CEO, CFO, COO, and other back-end functions like HR or finance. Those costs don't get allocated directly to a grant, but they say, this is 10% of my overall operational costs or 15% or something like that. And we will allow them to use their federally approved rate. And that is the recommendation of the finance committee. To complicate matters, the federally approved rate as of last week increased from the de minimis rate. So if you don't have a federally approved rate, it just defaults to 10%, but the federal government just increased that to 15%. So DHHS is still working through how we're operationalizing that. I think that is somewhat irrelevant for the purposes here of the vote, because we will just use whatever the de minimis rate is per the federal government or the federally approved rate that the specific provider has. I know this is a fairly technical topic, just by way of background as well, the syringe service providers, because an example might help. There are several syringe service providers that have a federally approved rate. There are several that use the de minimis rate. There are several that have, or I think one or two that have a negotiated rate with DHHS. And there are several that directly allocate all their costs and do not use an indirect rate. So in theory, all of those costs should be equivalent. It's just a method of allocating costs. But I'm happy to answer any other questions. Otherwise, we can have a motion and vote on the indirect rate of allowing providers to use their federally approved rate or an alternative rate for indirect costs.
Any questions for Ben?
For the dummy in the room, explain what this 15% of indirect costs would cover and how that affects. Because I know the last couple of meetings, there was talk like that it would go against, like it wouldn't help folks that are getting some of this grant money. So I don't know if someone could explain this to me, or like some sort of examples. I would really.
So just to go over that again, it's basically the C-suite, the corporate entity. So if there's it's basically only larger organizations that have various programs and various lines of work that they're doing that they would use this. So the CEO, CFO, COO, the HR shop, the finance shop, they don't directly allocate their costs to every single little grant that they might get. They come up with an indirect rate and say, 12% of the total costs of this organization are related to the infrastructure to keep it going, whether it's the leadership of the organization or the HR shop. The only other example I have is like, if you receive a certain threshold of funding from the federal government, you need to do audits every year. The audits could be a couple $100,000, and they don't, that would go into the indirect rate as well. So it's this sort of the corporate apparatus of an organization that is larger has an indirect rate. So the syringe service providers are going to get $75,000 each, regardless of whether they have an indirect rate or not. I do think we'll need to be mindful of what providers are submitting for grant applications, that they're not, we'll just need to be comfortable with the budget amounts that they're applying for if they have an indirect rate of, say, 20% or something on that. And if we want to lower the project cost and see if they can absorb that, we can try to do that. But I think by just going with the federally approved rate, in some ways, in my view, it makes it's slightly more complicated and slightly more streamlined, depending on how you look at it. Providers that have an indirect rate will want to default to the indirect rate that they have on the books already, which I think you've heard Joe say as much. Bruce?
Yeah, I don't have any objections to the Finance Committee's recommendation, but I thought Brendan pointed out that there was some sort of maximum direct rate.
Yeah, we discussed that as well. It's a good point. So I think there's various ways to interpret this, and Brendan can answer this, but in my view, I think the indirect rate associated with organizations that are delivering opioid services, opioid prevention services or treatment or whatever it is, can be just considered part of the cost of doing business. So we have a 15% admin cost that we can't use more than 15% of the settlement dollars for. But I think all of this would be considered direct services and would not count against that cap. And for example, but like our contract with Barry Dunn or our contract, to administer the Maine Recovery Council can't exceed 15%, which, it's easily over $1 million a year. So we're not going to exceed that, but we'll obviously track that, but I'm comfortable we can stay under that. Brendan, did I mess anything up there?
I think that's right. I mean, the settlements, have a definition of, what abatement means to, for the funding. The MOU narrows that definition so that, the money in Maine can be spent, strictly on the services described in Exhibit E. Ben's description of, this is the cost of, this is part of providing these services, I think is a very helpful characterization to consider these things. This is what it costs to help people to do the abatement work. And so I've looked at the settlement and I've looked at the MOU and I'm comfortable that that these are allowable as abatement.
Do we need a motion,
Gordon?
I'm gonna make a motion, having been one of the people that referred this back to the Finance Committee. I appreciate them looking at it. I think the document is very responsive to our concern. The first proposal would have, I think, eliminated a lot of organizations from applying for grants. So I like what they've come back with, and I appreciate their work, and I would move that we accept the policy as delivered to us today by the Finance Committee and thank them for their work.
Second.
It's been moved and seconded by Liz. Any further discussion on the indirect policy? If not, can you call it, please?
Liz Blackmore.
Yes.
Todd Brackett. Lydia Crafts. So gone. Betsy Fitzgerald,
Yes.
Courtney Gary Allen,
Abstain.
Pat Kimball,
Yes.
Ben Mann,
Yes.
Bruce Naughton,
Yes.
Miles Olet,
Yes.
Eric Small,
Yes.
Gordon Smith,
Yes.
Tina Thackrar,
Yes.
Chastity Toole,
Yes.
Paul Vinsel.
Yes.
It looks like Todd's back up if you want.
Did you hear the motion, Todd?
I did, and yes.
Thank you.
Thank you. And Ben, I would ask that we move to the presentation because we have these wonderful people that have come here. I promise in my next meeting, I will put finance first. You get shortchanged every week, every month. So I promise it's at the top of the agenda and you won't get gypped. I shouldn't say that. Excuse me, shortchanged.
Nope.
Thank you.
No problem. Thank you.
Thank you very much. All right. Thank you. So the long-awaited, I'm gonna turn it over to you, Liz.
Awesome. Well, I would love to. We have PowerPoint and presentation or some sheets, and I'm gonna invite my work group members. So if you all don't mind coming, if you wanna just join us here, and I'm gonna sit over by the computer because I am an animator on my PowerPoints and everything animates, so I have to press the button. Is it on, which computer is it on? Oh, on that one, so I'll just sit right there. Thanks, Mary.
Where would you like us?
Oh, wait, do you all want to just sit at some of these tables, like the chairs, this chair too? And then we also, Amran has been promoted to the presenter. Thank you. He shares.
I got my, yes, mine.
Awesome. So thanks y'all for letting us come to talk to you today and for having us, do this work. I know I'm thrilled to be, have this for you and thrilled with the process that we had and the group that came together. And I think, we're all excited to share with you our recommendations. You have a full report that has a lot in it. We're gonna highlight some of that stuff in a presentation for you and then give you some opportunities to ask us questions and hear more from the council or from the work group. So I think just to start, I wanted to share with you just a reminder of what our goals were. Our goals were really to provide you with some recommendations for preventing funding priorities. And so I'd love to just start with having folks introduce themselves so you can hear from them directly. Some folks are going to present today. Some people couldn't come. They were sad not to be able to come, but their fingerprints are all over the document. So if we can start with Amran, do you mind introducing yourself and just telling the group about where you work and how you come to this, what your specialty in the work is? And Amran is on the Zoom.
Yeah. Hi, everybody. My name is Amran Osman. I'm the executive director of Generational Noor. I'm from Lewiston, grew up in Lewiston, and the work that we do is destigmatizing the conversation around substance use disorder and mental health, particularly in the immigrant and BIPOC communities, getting them resources that are culturally competent, but also making sure that the community is talking about it, especially in spaces where it's stigmatized. And I'm in this space due to the work that we're doing, especially in spaces where this conversation hasn't been had prior.
Thank you so much. And we'll introduce everybody that's here and then we can tell you more about the other folks too. So do you wanna?
Sure. Hi, everyone. Melissa Hackett. I use she, her pronouns. Thank you for this endurance marathon of a meeting and having us present at the end. We'll try to bring lots of good energy into the room. I do largely state level policy work. I'm a policy associate with the Maine Children's Alliance, and I also coordinate a group of folks under the banner of the Child Welfare Action Network, really focused on child safety and family well-being.
Hi, I'm Leanne Dodge, she, her pronouns, and I'm the program director of one of the drug-free community coalitions. I'm in South Portland. And I'm a certified prevention specialist, and for 20 years, I taught the class for folks who've been arrested for operating under the influence, the DEEP program, and I taught the under 21 young folks. But my passion really is for the 18 to 25-year-olds that I'll talk to you about shortly.
Hi, I'm Sarah Harlow. I'm the co-director with the New England Prevention Technology Transfer Center, and we've helped on the back end of this ad hoc committee process, figuring out how we wanted to go through that process with Liz, and then providing support on the recommendations.
And then we also had Andrea Saccobason, who works for Wabanaki Public Health and Wellness. April Hughes works for Healthy Communities of the Capital Area and does a lot of work with LGBTQ plus young people and thinking about that population. Brendan Schaffler works for the Oxford. I'm not like looking at my notes here. I'm trying to do it off the cuff, which isn't probably not the smartest thing. Brandon, Oxford County Wellness Collaborative, so does a lot of work around supporting communities in their work to prevent and address adverse childhood experiences. Jamie Comstock from Bangor Public Health, she is a certified prevention specialist, as I think Brendan and April are as well. And Jamie works for Bangor Public Health and is on the Substance Use Disorder Commission. And then we also had Madeline Roy, who is a young advocate with South Portland, the SoCo Unite Coalition. And Mateo Hardy was also a young person working with, he's on the Youth Advisory Board for the Healthy Communities of the Capital Area. So we had a pretty well-rounded group. You'll see in here what that we tried to really get geography and also demography covered, and also different areas of prevention. So I just want to briefly, one of the things we did at the beginning was to really define what we all believed is prevention. And I feel like it's important for you all also to hear what the sort of the framing and the way we were thinking about prevention, because I think it's really important to then the recommendations that we are offering you. And I think people often think of prevention as sort of the action of stopping something from happening or arising. And I think our prevention vision is more than just stopping something from happening. It's really about wanting all youth and all young people to have opportunities for thriving. Because when young people have opportunities for thriving, we know that they're healthier and have greater well-being. And so I think in prevention, we really are asking the question and trying to understand why and how opioid use disorders happen and promote community conditions that are best for keeping opioid use disorders and substance use disorders from arising in the future. And so many of you might be really well aware of the waterfall story, but it's the one that sort of guides a lot of our work when we're thinking about people falling in the waterfall. I'm sure you've heard the metaphor before, that we spend a lot of time thinking about pulling people out of the waterfall and pulling people out from below the waterfall. But in prevention, we're really trying to think about what happened upstream that people started falling in the water in the first place, right? Like, how did people get in the river? And so, in prevention, we're really thinking about what are those key risk factors and those key things that brought people really close to the river or pushed them in the river to begin with. And we know for opioid use disorder, family history of addiction and genetics is a key risk factor, a history of mental illness, early use of any substance, whether that's commercial tobacco, alcohol, cannabis, and other drugs. That early use puts someone at much greater risk for opioid use disorder, as well as adverse community and childhood experiences. And all of those things, if you add in then access to opioids, those are like kind of the key risk factors for how people end up, in the river in addiction. So, one of the things that kind of has guided some of our work is thinking about when we know that when prescribed an opioid by a doctor, a person who had a prior substance use disorder is 28 times more likely to develop an opioid use disorder. So this connection between substances is really important to think about. And it's why when we're doing opioid use disorder prevention, we're really trying to prevent for any substance use disorder because we know that's opioid use disorder prevention as well. And we know that higher levels of adverse childhood experiences is directly related to increased risk of opioid use disorder and the severity of an opioid use disorder. And there's actually been a lot more research on also adverse community experiences and how those are a huge part. You know, people who live in are put at greater risk for an opioid use disorder when they're living in a place where they're experiencing lots of discrimination or their housing is insecure. And so we think about this like layers of toxic stress, right? There's like household toxic stress that I think we're all familiar with, but really this community toxic stress also has a huge impact on an individual, but on families and on people's risk for substance use disorder. So thinking about discrimination, poverty, there's great research around when a plant closes in a rural community that doesn't have a lot of jobs, you see a direct increase in opioid use disorder and opioid overdose deaths when a big plant closes with lots of job loss. So we know it's like bigger than just adverse childhood experiences, but also what's happening in the environments that people live. So then we're thinking about how do we address those kind of root causes. We know it takes a whole community approach. So in our prevention certification, you know, a big part is thinking through the prevention science focuses on the development of evidence-based strategies that reduce risks and enhance those protective factors across the whole community. So this is a really familiar little bubbles to folks in prevention because we think a lot about how do we impact individuals, but we really have to think about those individuals within in the context of their relationships, right? Their families, their social networks, the organizations that they have access to or don't have access to, the communities they live in, and then the policies. Those are all parts that we have to be looking at. We can't just change someone's individual knowledge because we all know that knowledge isn't necessarily tied to behaviors, right? Like, I know I should sleep 8 hours a night. I know I should eat 5 fruits and vegetables and do my exercise, but there are many things that get in the way of that have nothing to do with my knowledge. They have to do with the family I'm in, the community I'm in, my 2 jobs that I work, and the policies. You know, it's much bigger than that. So in prevention, we're looking at all of those things. And so a big part of examples of addressing those root causes is preventing and reducing youth substance use. And you know, there's deeper stuff in your report, but I just want to share with you, these are the 7 strategies for community change. And there are low-hanging fruit. So this is a tree because it's low-hanging fruit to enhance skills of young people and provide them with information and provide support for positive youth development. That's sort of like basic stuff that we can do that will have impacts on individuals. But if we want to have impacts on whole communities, we really have to do this much harder work that is way more effective. So reducing barriers or enhancing access to those vital community conditions like transportation and housing. We have to change the consequences to things that support positive youth development and aren't just, you know, about punishment. Making environmental changes for healthier communities and then changing policies. I mean, we've seen that in other realms, right? In the harm reduction realm, changing the Good Samaritan laws has had a huge impact on our ability then to reach people and prevent overdose deaths. And that's similar with prevention. We have to ultimately change policies. So another example of addressing the roots is, you know, reducing adverse childhood experiences and increasing resilience. Resilience is found to be a major protective factor for against developing an opioid use disorder. So things that impact that could be examples of that are things like, you know, environments around creating social connectedness. And you'll see in our recommendations that some of these things come in there, right? improving access to integrated social services and supporting parents' well-being and economic stability. And improving behavioral health supports for young people is a really good way to be addressing the root causes of opioid use disorder. So, improving access to behavioral health treatments and supports, diverting youth substance use to other programming, providing support to parents and caregivers of young people who are using substances. And then we have to consider differences. We spent a lot of time thinking about how do we ensure that there's culturally relevant strategies, because people are at greater or lesser risk depending on their individual family and community conditions. So thinking through, discrimination, historical trauma, economic, food and housing insecurity, access to resources, and the family context are all really important for us to consider when thinking about specific strategies we might end up using. And I do want to share a couple things that we know don't work in prevention, because I think there's still a lot of misperceptions about what does and does not work in prevention. And there are really clear research on that scary images and scare tactics, one-time assemblies and events really don't work. We know that personal testimony for people in recovery can be really important for treatment and recovery. It has not been found in the research to be supportive of prevention. It may increase people's understanding in the moment of harms, but it does not bring young people to change their behavior. And so, role playing, mock car crashes, and drug fact sheets, all of those things we know are not effective. And so resources are limited, right? So we want to make sure we aren't supporting prevention that doesn't work. I think it's also, we have to be clear that some of these tactics can actually cause harm. They're not just innocuous, they actually can cause harm. And that often what I think it's important to understand why those strategies are ineffective is because of brain development. Young people don't think, and they think they have they're in a different period of brain development. Sorry, Sarah. And in that period of brain development, they assess risks differently. They see what's going on in their community differently than adults do. And so when they hear scare tactics, they go into denial, they can go to numbing and avoidance, or they can be really skeptical and think that everything you're telling them is a bunch of BS, right? They might think it looks fun, or, oh my gosh, this person is actually now getting the recognition, or they're getting lots of people listening to them. No one listens to me. And I think it can also inflate perceptions. We actually know it can inflate perceptions that all young people are using. So there's some good resources linked in the electronic version around these, and I encourage you to look at what works in prevention and doesn't, and share it with the folks that you work with, because I think we fight every day against folks who want to do they have best intentions, but want to do prevention that we actually know is not effective. So that was kind of our frame for how we were looking at prevention, and was the group really used as our process then for, or sort of as the foundation for how we did our work. So I'm going to pass it to Sarah to give us a little bit, share with you all our process that we had.
Thanks, Liz. So the first thing that we did when we met together was to establish how we wanted to meet as a work group. So part of that was creating our community agreements, what we expected as a goal from those meetings together, and also, as Liz was just describing, our shared understanding of prevention, so we were all on the same page. Once we had that first meeting, we moved into gathering some information. So we collected data from the Maine CDC, from PCG, who evaluates the New England PTTC and also does some other evaluation throughout the state, the Maine Department of Education, from our team at the New England PTTC, and from all the work group members. And in that data collection, we were looking at what are the current assets for prevention in the state, and also what are the gaps that we're seeing across the state. So the following meetings, we determined which of those gaps were the most important to address. So part of that work included some prioritizing of gaps, both together in conversation and also individually on our own time, which was a little bit more anonymous to make sure that we were prioritizing based on our own experience and having the opportunity to do that with one another. Once those were prioritized by importance, we looked at the feasibility and the fit with funding. So once we knew what was going to be the most important to us to address, we wanted to make sure that those things were addressable and that they tied in with this funding that the council is looking to disperse. Our final meeting, we wanted to be sure that the recommendations we brought to you all were ones that we all felt really comfortable with moving forward on and that we thought were really important and fit with the funding. So these were our community agreements. This is how we wanted to spend our time with one another. And these were brought to us and then we added some as well in that first meeting. And we made sure that during each of those meetings, we continued to agree on how we were going to interact with one another. And a little bit about our assessment process, which you can see more information on page 23 in your report. This was the information that we collected from many different organizations. And that also included a really in-depth conversation with the work group members about what they're seeing in their areas of expertise as well as in their geographical regions. So our big takeaway that we found from that assessment process is that there's really a lack of long-term sustainable funding for substance use prevention in the state of Maine. In the year 2023 to 2024, we did have 7.2 million for Maine CDC SUP funding, and that number is going down to 4.8 million in the following year. So that's just something to acknowledge that a lot of that funding is going away.
And I'll just add some of the reasons that we think there's chronic underfunding is really around public perception of prevention. You know, there's a lack of understanding of prevention and there's this misconception that is kind of quietly working and it doesn't need extra resources, like, oh, people are doing that. And we also think there's some sort of systemic disincentives, that prevention really takes time. And it's, we know that it delivers a strong return on investment. It's like this average of $7.50 to every dollar spent is actually, when you look at individual substance use prevention programming, it's sometimes $14 to $25 to every dollar spent. So it's a huge return on investment, but those multi-year investments are really not prioritized when there's yearly or biannual budgets. You know, it's really hard to prioritize that. And then lastly, I think, you know, there's some structural gaps. Most of Maine CDC's substance use prevention funding is federal funding, and several federal grants are coming to a close. There is a little bit of Fund for Healthy Maine money that comes from the tobacco settlement, and that contributes about $780,000 annually to substance use prevention. But that also is in jeopardy because of an impending shortfall on that Fund for Healthy Maine. So I think we wanted to make it clear that there's no funding beyond the Fund for Healthy Maine for substance use prevention in the Maine General Fund. All of the additional funds are federal funds.
So the first thing we looked at when we were doing our robust assessment were our assets. And those are outlined on page 23 of the report. So one of the assets was around our funding. We do have some current funding, but again, that funding is going down in the next couple of years. About 1.6 million annually for the DFCs, which are in 13 of the communities. And there's also some funding from the DOE to do building assets and reducing risks. We also have Maine CDC programming, which includes the MPNs, information dissemination, some media campaigns and safe storage, drug take back, policy development, educational programming, etc. We did want to include that in here to really outline what is already being done in the state and what does already have funding. And for other prevention programming, as we mentioned, the Maine DOE is doing BAR, but also community school pilots and a social emotional learning for me. The DFCs also serve 13 of Maine's communities, and those are 5 to 10-year funding cycles. We found during our assessment that there were over 30 gaps in what is being offered already in the state. And we decided to emphasize and really prioritize kind of a few categories of those. So the emphasis on upstream community conditions work, which is a lot of what Liz was talking about a moment ago, what's happening in the community to support thriving young people. Needing more community-led strategies that improve community conditions, and prevention providers need to have that capacity in order to create collaborations with other folks who are working to impact the lives of youth. Also, the 2-generational approaches within the state that really builds those strong family sense of well-being that are intentionally and simultaneously working with children and the adults in their lives. We recognize that children, especially those who are children whose parents are affected by addiction, they need more support and behavioral health resources. Prevention providers also need more support on effective strategies and engaging diverse populations, and that diverse populations piece is kind of the highlight of that, that bullet point. And also needing more substance use prevention geared toward the 18 to 25-year-old population. And that's something Leanne's going to talk a little bit more about in a minute.
So in terms of our strategy recommendations, I think I want to just start by just giving you a couple of cross-cutting recommendations that we had. These are not specific to a specific, they aren't specific to strategies, but sort of a way of doing things. And I think one of those things is about time. So I think I want to just put out there that while the Maine Recovery Council may allocate funding for 1 or 2 years, we would highly recommend that the Maine Recovery Council allow recipients more time to actually spend down the money. Because 1 and 2 year cycles, again, as we said, is very difficult for prevention to have, that really like let people know how much money they have, but give them more time to do it in. So even if it ends up being, you know, where you chop off money up front and say it's $1 million, like, but give people more time to do the work. It's really hard to do it in these short-term frames. Amran's going to share with us a little bit about the next 2 cross-cutting recommendations.
So our next recommendation is to place a strong emphasis in the RFP and provide incentives for the applicants that provide culturally relevant approaches to historically marginalized groups within all the prioritized gaps. Because in order to help communities, you have to have the communities that you're helping at the table and getting the resources. So making sure that there are incentives for those who are a part of the conversation and getting the resources, but also, for example, I know it's hard, especially within like the government, to do stipends, having that as part of the RFP because and then placing a strong emphasis, sorry, you can go. Placing a strong emphasis in the RFP and provide incentives for applications that support collaboration between prevention providers, community-based organizations, and those who have lived experiences. Because in order to make things happen, you have to have everybody at the table. You can't help a community without the community at the table. You can't help somebody struggling unless they're willing to ask for help, especially within the immigrant and BIPOC communities. A lot of these communities are behind other communities that are struggling with substance use disorder and mental health. And there's a lot of resources, but a lot of the resources are not culturally competent and don't know how to help these communities. So having people from the community at the table and collaborating with organizations and other resources.
Great, thank you. And I think you mentioned this last one too, actually, which is accessibility funding. So allow for funding that is like for stipends or transportation or childcare or food for community partners to actually participate in funded projects. There are some grants that allow you to do that and some that don't, but it's really important if we want to have community-led, community involved projects. Often people need some form of excessive funding to make that accessible to them. So those are our cross-cutting recommendations. Our first key strategy recommendation is that The council support or expand culturally relevant, community-led and youth-led efforts that improve the community conditions in communities highly impacted by opioid use disorder. So we have a lot of information in for you in there about, there's in the assessment, there are a lot of gaps related to this upstream community conditions work that needs to happen. And so this recommendation would be addressing those gaps and also the gap of projects that are actually led by the community, and then being supported by prevention providers and ones that are culturally relevant. So some examples, I think this one, we wanted to provide you with some examples of things that are already happening, but could be expanded upon or could be replicated in other places. So there are some examples of an infrastructure that could really support the implementation of this strategy. And those are community collaboratives and community coalitions. There are some community collaboratives and coalitions that exist that are really doing some of this work of convening and collaborating and working with community to address community conditions, but often they're super underfunded. They're working on super tiny shoestring budgets. And given more funding, they would have this ability to really tap into the expertise and knowledge of the community to improve the community conditions, especially in places that have been highly impacted by opioid use disorder. So some examples of those, we have some community collaboratives that exist, like the Community Caring Collaborative in Washington County has been doing amazing coalition collaborative work. Helping Hands with Heart was another organization in Piscataquis that really is deeply working in communities to change community conditions. Oxford County Wellness Collaborative, Southern Mid-Coast Communities for Prevention, and SOPO Unite are all other versions of coalitions that are doing this work in community. And so there's something to already tap into, but we really could use a major expansion of this work. So some examples of the approaches that those community, that might really help to make changes in community conditions could be, there are frameworks. There's the Adverse Community Experiences and Resilience Framework, there's Building Community Resilience, there's Youth Advisory Boards. So we've given you some examples of those things. And then we think there are some potential activities that could really be implemented within those coalitions, like transportation for youth to get access to healthy community opportunities, positive third spaces for young people, resources and supports for young people and their families, specifically behavioral health ones, support for gay, straight, trans alliances and Black student unions and other affinity groups. So we're kind of throwing a lot at you, but I think the point of this is to say that while this recommendation might seem really big, we think there are a lot of really specific things to build onto that could have really big impacts in communities that have been super impacted by opioid use disorder and opioid overdoses. A few other considerations around this recommendation is to consider that, there are these coalitions that could really be ready to take on some of this work. I would ask that we consider, could a philanthropic organization take on the RFP and grant oversight, or we could do that ourselves here, but we've seen that that's somewhat complicated. Could we fund an organization like a nonprofit or a philanthropic organization that could provide technical assistance or a learning community to these organizations doing this work? This work is not easy, and there are organizations that could be ready to go to help support these coalitions to do the work better and make it more sustainable. Providing incentives, these are things we've sort of talked about already, and our overarching guidance. I think prioritizing programming that's focused on youth and community leadership and partnership over programming that's directed at young people. And then evaluation funding would also be great to understand how changes were made because of the programming. So we'll come back to your questions, and we'll just run through all of our strategies, and then please feel free, we'll answer any questions you have. Melissa's going to take it over from here to share with us a little her thoughts on our strategy number 2.
Thanks, Liz. We will continue to bowl you over with information.
Yeah, I know.
Gently and kindly. So strategy 2, the recommendation is to increase 2-generation approaches to prevention with a focus on families who have been impacted by opioid use disorder and or families that live in communities who have been highly impacted. Just to give a little bit of an overview, not wanting to assume folks are familiar with the 2-gen work. Sarah mentioned this in some of the introductory remarks. This really focuses on building family well-being by simultaneously working with young people and the adults, parents, and caregivers in their lives. And this whole family approach generally includes a coaching component and wraparound support. So how do we really, I love the wraparound idea. How do we really recognize the holistic needs of the family? I'm a huge proponent of saying that we often talk about directing services and supports to young people, not recognizing the context that they're in. They all live in families, they all live in communities. And so the more that we are acknowledging our interventions and our support with young people from that framework, the more successful it's going to be. And so again, this is really responding to this gap. And I just want to say like a note about this work group. We really, there were a lot of gaps, and we really beautifully, I think, came together around a couple of key strategies, recommendations. But there was a really strong discussion about this need to really have this 2-generation approach to disrupt generational cycles of substance use disorder and opioid use disorder, to really be sure that we are supporting children who've been impacted and affected by that, and also the adults in their lives who are supporting them. So some examples of how we might achieve that strategy. We had a really substantive conversation about kinship care support and resources. We've named here Adoptive and Foster Families of Maine as an entity in Maine that's doing some of that work. They have something called the Kinship Program, and they're also piloting a more intensive kinship navigation service. But they're restricted by the different funding resources that they have. So for instance, they might have more resources for formal kinship care providers who are licensed, but we know that a lot of families choose to be unlicensed and to operate outside of the formal system to provide support. And I just want to name a few things here around kinship care in particular, because this is really my policy area. We often, I think, don't talk enough about the impact of parental substance use disorder and children being separated from their families. And that is a point that I bring into every conversation that I'm in. In 2023 in Maine, 55% of children who were removed from their families, it was due to parental substance use. So really recognizing that that's had a tremendous impact that is high compared to the nation, and it has been historically high in Maine. In 2021, the census data estimates that around 5,000 grandparents are responsible for raising children. And there are other estimates that are around 9,000 children who are being raised in a home without their parent, without either parent. And as I mentioned, we know that many more kin families are providing care to children outside that formal system. The estimate is for every one formal kinship placement, there are 12 to 13 who are providing support to children outside of that formal support. And the supports are disparate. If you are licensed, if you are in the formal system, you generally have access to more supports and services than if you are outside that. And so imagine a scenario where what is typically the case, a grandparent who is on a fixed income, limited income, is suddenly, fairly suddenly taking care and responsibility for a child, and the financial implications of that, as well as the behavioral needs often of children who've experienced some of that trauma of being in a home where there is substance use, being in a home where there is neglect, and then being separated from their family. So a significant amount of trauma, and really wanting, again, to have this 2-generation approach of what has this child gone through? What are these grandparents or other kinship care providers going through as they take on care and responsibility for the children? And how do we wrap supports and services around both of them? And then as we look at some 2-gen models, the John T. Gorman Foundation is really, I think, taking a lead on this, and has really set a strategic priority around these programs. These are just a few examples. Family Futures Down East, which is in Washington County. And I would name, as we think about these recommendations and these strategies, Family Futures is a great example because it was actually incubated through the Community Caring Collaborative in Washington County. So I think a good example of when you invest in that community infrastructure, the kind of programs and supports that can come out of that are responsive to the community needs. Families Forward, which is out of Bangor and Macaulay residents. And again, they all have these major components of the two-gen approach, which is developmental opportunities for children and youth. So that might be childcare, it might be after-school programming, education and job opportunities for the adults and caregivers in the home, economic asset building, health and well-being services, and social capital. And I really want to pause on that one because we hear so often from families and families that have been impacted by substance use disorder that there's so much stigma attached to that, and being able to build relationships in these cohorts of parents who have similar experiences and the kind of informal relationships that they can build with each other is a really strong asset. And we don't often think about that in our technical services that we provide to people. So that two-generation approach really brings that, building that social capital and connection. And I'll just name a couple of, there are always like these core components, but they often take on a different flavor. So Family Futures Down East is really focused on associate's degree, bachelor's degree for the parents, and then focus on childcare. So there's like specific focuses. Families Forward is particularly focused on housing, and then school readiness, and Macaulay Residence has a particular focus on housing and transitional housing for moms and their children who've been affected by substance use disorder. And then I think Liz did some really great level setting about adverse childhood experiences. I think there's a pretty good body of research out there that we're familiar with about the variety of adverse childhood experiences that can really, particularly when there's an accumulation of them, really prevent the kind of positive outcomes that we want for youth and adults. And so we know that there are a variety of entities in the state who are really focused on providing some support around what we understand to be protective factors. So we know what the risk factors are for substance use and for opioid use disorder. And we also know what the protective factors are for individuals and families. And so a couple of entities named here, the Maine Prevention Councils, they do universal support to families. There's a statewide network of them, one in every county. They do parenting classes, they do support groups. So really thinking about this universal access to parents across the continuum and their children. And then as we look at some other approaches like strengthening families and the ACERT, again, these models that really lift up what are the protective factors, and then how do we provide programming that supports promotion of the protective factors versus just focusing on the adversity, right? It builds that resilience to talk about what helps to build protective capacity for families. So other considerations, and I really appreciate when Liz went through this, right? They're very similar to what we just talked about. Considering some of the work that's already happened for the council in terms of getting money out the door to the folks that are doing it, we would also recommend a consideration around if there's an entity that could provide technical assistance to the folks that are doing this, community of practice, folks doing this work say, it's really a benefit to talk to other people doing the work and learn from each other and figure out how they might collaborate, how they might learn from each other. Again, an emphasis on really ensuring that organizations who pursue this funding have an opportunity to consider how they are adapting it for the community that they're working in. And then to really look at the evaluation again, so we can understand the impact that's happening as a result of this. And as we consider, in primary prevention, a universal approach, also really prioritizing the communities that have been most highly impacted by the opioid epidemic.
Thanks, Melissa. And lastly, we have this strategy around the 18 to 25-year-olds. So Leanne's going to share with us a little bit about that.
So I'll just talk fast, but I started my career as a hall director at the University of New Hampshire. I lived with 600 college students all year long, good times. And I used to think, oh gosh, if we could just get to them earlier. And that's where I kind of got my first vision of substance use in young people. So the beauty is I've spent the last 8 years, my office is in the South Portland High School. So it's been a great, not everyone gets that great opportunity to have both worlds.
I had.
Yeah, right.
I did it.
I'm writing a whole book about it called Where Are You Supposed to Be Right Now? Because I think we're preparing young people for life after high school. 18 to 25-year-olds is the highest risk using group. And we do almost nothing for prevention or intervention. How do I know that? Well, in 2006 to 2009, I worked for the Higher Education Alcohol Prevention Partnership. It was called HEAP. Again, 3-year grant funded, and We worked with every college and university in Maine and did all the trainings for the resident assistants. We taught everyone how to do the only evidence-based program, which is called Basics, which is brief alcohol screening and intervention for college students. So we did all of that. We met with all the presidents. You couldn't, it was with, who was the Attorney General then? Steve? Yes, he was awesome. And every president had to come from every school. You couldn't just bring your vice president. You had to be the president. And really did a lot of these great important trainings. Now, I met with about 8 campuses in June, some students and some staff. Very little is getting done on college campuses for prevention or intervention. And many campuses, even when you're 18, you can wander around and drink alcohol. As long as it's not hard alcohol, you can have beer and hard seltzers. And we do give out water and crackers for St. Patrick's Day. You know, I could go on and on. I know we don't have time. But what is concerning to me is that people, after they are out of high school, are like, yeah, good luck to you. And we forget about the brain development, not till your mid-20s. And here you are, come to college, which has higher rates of use than if you didn't go to college. So anytime there's a group, there's higher risk and higher use. So that's one piece, is doing more work with college campuses. And we have all of us who work in prevention that could be doing more with our nearby campuses. So that's one of those really important pieces. Then what about if you didn't go to college? Where are we reaching those people? Highest risk group, 18 to 25-year-olds. Where are they? Raise your hand in this group. If you think back to your high school jobs, did anyone have substance use in your job? Anyone work at a restaurant or as a young person, maybe not in high school? And most people like, yeah, after work, everyone had, so we created a program years ago called YEAP, Youth Employee Assistance Program, which is really for employers to have a healthier workplace, especially in the hospitality industry. Right now, we're creating a training for young people before they get into the workplace. So looking at those both worlds, we're not doing much. That's not good. It was just so startling for me to meet with these campuses. And I'd said, well, what if someone is struggling? And they go, well, unless they're just not doing well academically. And we might say, hey, Chastity, why don't you take a semester off? And that was their intervention. Yeah.
What kind of incentives does Eve offer these businesses, and are businesses buying into?
Yeah, it was right before COVID, so we haven't really done enough with it. That needs to be definitely reinvigorated. The state owns it now. It was done through the Opportunity Alliance, actually created this. And it was starting to get going, and then COVID hit, but it is something we want to revive because there is so much substance use. And not just in restaurants and stuff, but in other jobs that people have. So just looking, you have this all in your book too, but really to get together and get back with the college campuses and communities that have young people working at their places. How do you do that? How do you intervene, do prevention and intervention? And again, training staff. And people forget that substance use is also very connected to other not good things like sexual assault and suicide. So I worked for a long time at USM, and I worked closely with folks that worked on those, and we would do trainings together. But those three things are often connected. So you just think it's not just, well, they're college kids, let them do their thing, no, there's other not good stuff, not just developing a disorder, but other really risky behaviors that could be happening that we're like, well, as long as you're, just drinking beer, you can have, that was just like rocked my world. Anyway, this is all up here, and I know we don't have much time, but there's a lot of great things we could be doing, and maybe getting a staff member at the CDC who focuses just on this. This is always started when no one is doing this. What? Someone's got to do this. This is important. Who's it? Because we're all, so just, the drug-free communities, we do 0 to 18. Then after that, you're on your own, right? But the tagline is so that they become healthy adults. But again, who am I handing these high school students off to? I did my part. Where? What's happening? So really thinking about working with anybody that has contact with 18 to 25-year-olds. Where are they? Whether it's in the military or it's jobs or campuses, we need to do much more. So happy to answer questions.
Well, and I'll say that, you know, and the reason we aren't doing the 18 to 25-year-old now is because there's no money. It's not like there isn't a desire, there's a strong desire at Maine CDC to do it, but they don't have any funding to do 18 to 25-year-old work. And the Maine Prevention Network prevention staff also don't have any funding to do that work, but could be poised to do it and have relationships that could do it. With additional funding, that then, especially a person at Maine CDC could help plant some seeds for them to then apply for additional funding in other places, whether that be through the state and through federal grants to really specifically work on that population. And I think lastly, we just wanted to share with you one additional recommendation that we sort of made but didn't make. And one is that we think that Maine needs more capacity and resources to support collaborations across the continuum of substance use disorder. New Hampshire has a pretty strong continuum of care model in which they fund folks to work in every district to really to make sure there's coordination and connection between the different pillars, if you will, of the continuum. We feel like that should be funded through all the pillars, not just the prevention pillar. So we didn't take it up as like a specific strategy to be funded under prevention, but one that we recommend the group think about in the future. So I know we just threw so much at you and we just have a few minutes and we'd be more than willing to come, you know, we can answer questions now, come back to this at the next meeting to talk about like, do you all want to talk more about these or you know, kind of move forward or approve some version of these recommendations, but we are happy to take questions.
So can you take this being done so we can see people that are on the Zoom for questions?
Yes.
So first, I just want to say, this is amazing. This is very well done. It tells a story about what needs to happen and what recommendations. I really applaud your work and thank you very much. So this is the part of the job of the chair I hate. So I just want to remind you that we have to be hard, fast, done by 4:45 because this building closes at 5. And we have to give all of them time to take down their equipment and do what they need to do. So at this point, questions from people of the council. And I think my recommendation probably would be that this go to program and grants. They look at it, then bring it back here and we'll get moving on some of this recommendation. But this is your opportunity to ask some questions. And if it is the council, if they want them to come back again, we can also do that. But my initial thing is that we put it through programs and grants. They work it out and bring it back, the recommendations from there. But here's your opportunity.
So thank you, Pat, this helps me a lot. This is fantastic work and thank you very much. And I really feel gives us a really good overview of our prevention. And it seems to me that in each of your strategies, there are people already doing the work that need additional funding. So would it be a reasonable thing for us to say, okay, you get this much, you get this much, you get this much of places, so that we don't have to try to reinvent the wheel. We just give more speed to the wheels that are out there. Does that make sense?
It does. I think that having people apply to say like, I think we do this thing really well and we think we should apply because we want to do more of this. I think we would still want to have, for at least the first 2, we'd really want to have an application process for that.
So kind of like the grant application,
Yeah.
but only on prevention.
Right, and I think we could do that way. Personally, I really think we should really consider the 18 to 25-year-old work, giving that to Maine Prevention Network, to the Maine CDC to do it, because they need an infrastructure to do that work, and it could go through their infrastructure. as Leanne said, it's like a infrastructure that's been there and done that work in the past that could really do it. I think the other two might be, you know, we would want to solicit who can do this and who can meet these goals that we have in a expanded way, or maybe doing it in a different community, or, you know, that they feel like or that they can also tell us how their community's been impacted and how their project's gonna work, would be my thought.
Great, thank you.
Gordon, then Courtney.
Yeah, it's a fantastic effort, and thank you to all of you. My concern, and I'm glad it's going to it should be discussed at the Grants and Programs Committee. I would try to resist in every possible way a prolonged application process. This would mean, just based upon our own staffing and our own experience, that none of these organizations that might be doing this work now would see any money for at least a year. You know, based upon, that's a personal observation,
Yeah.
based upon our resources. We're not compelled to do procurement that way. There are a limited number of organizations that are capable of doing this kind of work. And if we can identify them, then we can invite we don't have to invite every organization. We can invite those that we believe could be trusted partners in this work and maybe cut 6 months out of that. So I just hope that the Grants and Programs Committee will look at alternatives on procurement, recognizing that, and I agree with you. I have thought about college campus programs. I've met with Bob Dana up at Orono. I've met with the college program at USM, but we've never had the finances to do a prioritization and say, we really need to be in this space. The community colleges are good.
Yeah.
The university, lots of potential players there. So I just want to get that on the table, is that I want to get this, we're sitting on $4 million, you know, and.
It'll be 8 million next year.
Yeah, well, I know, but let's get out the four as soon as we can. That's my desire.
Yeah, thank you, Gordon. Courtney?
Hey, Liz, wonderful job. This was amazing. I wish we had done the same process with every one of the pillars. And I wish you had facilitated it. So great job. My question about 1 and 2 was, when you talk about, are you saying that your recommendation would be to fund programs that are already doing work to expand that work versus funding new programs to get off of the ground?
I think we could do both. I think there's a both and kind of situation where we have organizations that already are doing this work and might go under because they don't have the infrastructure funding they have deep community connections. They have been doing great programming, but they get programming dollars for something like do this one little thing, when really we need them to be doing the work of leading communities, and then, you know, and working with communities to then change community conditions, which is like a different kind of money, right? It's like a infrastructure money. So there are organizations who I think are poised to do that work, who given additional resources could deeply impact their communities tomorrow. I think there are also places that don't have these resources, right? They aren't community collaboratives that are there. There aren't 2-gen programs happening that could use them. So I would want to, I think, to your point, Gordon, how do we do some like right away? We know we could identify a bunch of them and also open it to communities that don't have anything, where it's like we know those are places that need it. And are there, I think that might take some thinking. So I don't know if you two have things you want to.
Yeah, I love what you outlined, and I think it's both and, right? And I've been supporting a network of community collaboratives. It's like this, we've identified people that are doing the work already. There's some capacity to do technical assistance to bring on other people if that was available, right? So I would love to have that thought of like, what could go out the door to people who are doing it right now? And then what does it mean to like provide capacity and support to bring on other communities?
And I would say that too, the drug-free community coalitions, Liz used to work at the Opportunity Alliance, and they were mentors and wrote the grant for Westbrook, Wyndham Raymond, South Portland, and they were our really got us going on. So it's that same model of someone passing that on to, like Gorham's gonna try to go for one right now, but no one really wants to write it, or, you know, whatever.
Well, our staff, like the
Your
staff at my
staff's
office
doing it.
gonna help do it, because
Yes.
it's like, how do we, yes, expand those things that work into other places?
Yeah.
I wonder, wonderful. And then a couple quick follow-ups. I know we gotta go. I love the idea of getting on college campuses. As a 1L law student at Maine Law and a person who's been in recovery for a decade, if there's one place that I would drink again, it's at law school. I'm not gonna drink, but if there was, it's law school. So love that idea. And then the one that was your recommendation, but not your recommendation of like the recovery, harm reduction, prevention, and treatment community working together. That was actually my favorite, like starting to have conversations across those across those spaces, because I work in prevention with young people, and I work in recovery, and I work in harm reduction, and none of those people talk to each other. And it is brutal sometimes to be in those spaces and be a member of each of those communities, to hear the myths about the other parts of that community. And also to hear things that if that pillar had access to the other pillar, we could understand each other a little better around, like harm reduction on college campuses. We could have a conversation about why drinking beer is actually better for young people than drinking harder alcohol. But of course, we don't want them drinking at all. But how do we support them in their drinking as they are drinking? And just having those conversations across the pillars, I think it's brilliant.
Yeah, and I think there's models for that. I think we just felt like it shouldn't get all but funded by prevention, that it should get funded across pillars so that it's owned by all the pillars.
Yeah.
So I'm with
I
you.
agree. I agree.
Let's bring it back up, like, because I think we're gonna end up in a new realm of funding, right? Where it's one we can set aside funding for it, that's a cross pillar work, if people are interested in having that conversation. So thanks, Courtney.
Excellent. Any other questions?
I would just add really quickly, as you know, the Maine legislature passed that all high schools have to provide Narcan training to students as an extracurricular. So it's just, again, what kind of you're talking about harm reduction. Now we have students getting trained in the high school where before police weren't even carrying it in South Portland. We had 2 school nurses like, we've got it, they can come. I'm like, are you at the prom? Are you around Saturday night? And so now all the students are like, yeah, we need to be trained in this. And now students are asking social workers, can I have some Narcan? And there's no schools yet that are doing that where you can, I think Westbrook has it available, but so progress towards the harm reduction piece.
What a wonderful, so I love young people, and I love Narcan, and I love when young people have Narcan. And so I am so excited about young people asking for Narcan. And yes.
Yeah, and United Way came and met with our students because they're creating a 30-second animated video on how to use Narcan. So they met with our students who gave them so much information about what to do in those 30 seconds so that young people could learn. And they were like, oh my gosh, thank you so much. We never would have thought to do.
Yeah.
So, it's progress, you guys. Progress is happening. But I know
Literal feelings right now, because the young people that I know and love so much worked really hard to pass that bill, and literally having feelings right now.
Yeah, it's working. It's working, Courtney. Well, thank you so much. We'll you can connect with us to ask more questions. We can provide more answers to you if you have them.
I thank you very, very much. Council members, please hang on just a few seconds. There's a thing we forgot. But thank you. We will get back to this. We'll go to programs and grants. According to our bylaws, we have to have a public meeting.
Public hearing.
Public hearing or meeting. We can call it again, it's a meeting, a forum. Before January?
It has to be this council.
So it has to be this council. So at some point in time, we have to have a conversation, this council, before they go off board, in November.
When is that?
21st.
Did we do it
November
per year or
21st is folks.
iteration of the council?
Yes.
We
Are you
know-
sure? Can we rewrite the bylaws? Because we said that it would be at the first meeting of, like, we sure?
Yeah, change was never moved.
Yeah, the change was never passed.
So our last meeting is in November.
Your last meeting is in November, so.
And how many folks do we know who's going off yet?
We know of,
Process.
I know of 3 definitely. I've heard on and off, but I know of. No, I know of 2 definitely. That's all I know. 2 people have contacted, no, 3. 3 people have contacted me that they are definitely going off.
Got it.
And that's all I know. Unfortunately, Tina will not be playing. Representative Kraft and Eric have all, said they will not seek, a nomination for a second term. Those are the only 3 that have contacted me, so that's all I know at this
Hey,
point.
Pat,
Yeah?
a quick question. If November is our first meeting, would this be considered our last meeting? I
No.
had a,
November is your last meeting.
oh, okay. Thank you.
Yeah, November is your last meeting and somehow, you know what, at this point, it's too late. Let me get everybody an email about some suggestions and look at those bylaws in regards to this public, and maybe I can somehow piggyback it on the meetings that are already scheduled. That way, I'll send some suggestions to people and look at those bylaws, because at this point, I don't think we can make a decision on that. It's too late. Does that work for everybody?
Yeah.
Yes.
Okay. And maybe if I have questions, we can throw it into that governance meeting that we've commandeered to talk about the council business, so we'll figure it out. I thought, like Courtney did, I thought we could do it annually in January, but I
Yeah.
guess it has to be this council that does it, and you're off as of end of November. So. If there's no other business before the council, then I will adjourn the meeting, and I thank you all very much for your patience and your in your input and your work. Thank you.